Well, good afternoon, everyone. I would like to call this meeting to order. And at this time, I would like to acknowledge that we meet on the traditional land of Treaty 6 territory and acknowledge the diverse indigenous peoples whose ancestors' footsteps have marked this territory for centuries, such as Cree, Dene, Saulteaux, Blackfoot, Nakota Sioux, as well as Métis and Inuit, and now settlers from around the world. I will do a roll call. Councillor Wright.
Here.
Councillor Knack.
Good afternoon.
Councillor Principe.
Good afternoon.
Councillor Stevenson.
Good afternoon.
Councillor Paquette.
Good afternoon.
Councillor Tang.
Good afternoon.
Councillor Hamilton.
Good afternoon.
Councillor Rutherford.
Good afternoon.
Councillor Salvador.
Good afternoon.
Councillor Cartmel.
Good afternoon.
Councillor Rice.
Good afternoon.
And Councillor Jans. Councillor Jans.
Good afternoon.
Thank you. Adoption of the agenda. Would someone move the adoption of the agenda, please?
Yes, I'll move that the February 11th, 2022 Special City Council meeting agenda be adopted. Second.
Thank you, Councillor Stevenson, and thank you, Councillor Tang. Please vote.
In favor.
Yes, Madam Clerk.
I haven't seen the vote notice, so I'm yes as well. Yeah. Thank you.
Display the vote.
Display the votes, please. That is carried. Any protocol items? I see none. Select items for debate. There's only one item, 3.1, so I'll select that. Requests to speak. We do have two requests to speak from Glenna Kiliak and Katie Ingram. And if they're listening, I just want to explain the process to them that at council meetings, whether it's a special meeting or regular meeting, we do not hear from members of the public. And so we do appreciate that you have signed up to speak, but it has to be moved that we hear from you. But this is not the practice that we follow at council. So please don't be disappointed if we say no, because this is you members of the public can only make presentation to at committees, not at council meetings. So we do have a request to speak. Okay. And we can move on to the next item.
If there's no motion,
Yeah,
yes,
there's
you
no
can.
motion on that. Bylaws, none. Private reports, none. Oh, that's not. So we are going into our first item on the agenda, and if you allow me, I just want to first of all thank the administration for their hard work over the last few days. You know, they've been working evenings, nights, early mornings, and we really appreciate that. We are here to listen to administration's presentation on the options available for City Council to consider a local Edmonton-based restriction exemption program, as well as symptom checking options. We know that this is an issue that has been top of mind for many Edmontonians this week. I suggest that we, from a process point of view, I would suggest that we have a presentation from City Administration then focus our questions on that presentation. Then we determine whether or not we agree with the city administration's recommendations before we get into a discussion on the bylaws. So with that, I will turn it over to our city manager for a presentation.
Thank you very much, Mayor Sohi, and good afternoon, Mayor and councillors. Today's update responds to Council's request for administration to return with options and details related to the implications of implementing a municipal restriction exemption program and or active screening program, including options for both city-owned and operated facilities and citywide private businesses. Joining me virtually are members of ELT, Nicole Poirier and Michelle Plouffe, the Chair and Vice Chair of the COVID-19 Task Team. Also joining is our guest, Dr. Chris Sikora, the Edmonton Zone Medical Officer of Health with Alberta Health Services, who is only able to join us until 2:30 this afternoon. When I presented to you this past Wednesday, we heard a number of perspectives from each of you. In addition, we have heard strong opinions from the people working at the city and from Edmontonians. In a situation like this, there are just as many opinions as people who have them, and that's why the report today includes as much data-driven information as we are able to have and includes the expected consequences of decisions you may consider today. We are balancing a wide variety of opinions, values, and facts and bringing you our best recommendations. And in the past 36 hours, we have reviewed the intent and outcomes of the REP and other public health measures. We did a short targeted engagement with partner organizations, a very short targeted engagement. We tried to apply a GBA plus lens. We evaluated legal implications and risks. We evaluated resources required to implement and support such a program. And we consulted with colleagues in Calgary and our regional partners. And finally, we drafted a letter for the mayor to send to the province in accordance with the motion from Wednesday. I will get right to the point. The administration does not recommend that the city implement a restriction exemption equivalent bylaw in its own facilities or for private businesses in Edmonton. The context of the COVID-19 situation has changed since the restriction exemption program was implemented during the Delta-driven fourth wave. And in fact, the situation has even changed since we talked with you on Wednesday. The restrictions exemption program and its fundamental goal of incentivizing vaccinations has been successful. Over the course of the program, the number of people who received a second dose increased from 70% to more than 86%. For many individuals, there was some comfort in the restriction exemption program, knowing one could go for a dinner or at a restaurant or attend a hockey game, and that the risk of contracting COVID-19 was reduced. As we've learned, however, new variants of COVID-19 present new challenges. Both Dr. Hinshaw and Dr. Sikora have told us that Omicron is more transmissible and has more breakthrough infections than previous variants. Showing proof of vaccination does not have the same level of effectiveness at reducing transmission as it did during the Delta wave. We believe the REP offers more of a perception of safety than actual enhanced safety for Edmontonians. In addition, even if there is an increased level of safety from this program, we do not have the data to measure it, nor the expertise of the city to interpret it. The provincial restrictions exemption program was one tool in a toolbox of public health measures making up a layered approach to protecting Albertans, including Edmontonians, from the virus. Other layers in that approach, like capacity restrictions, have either ended or are scheduled to end by the 1st of March. The potential municipal restriction exemption program on its own, without the extra layers of other provincial health measures, will not be as effective, in our opinion, as it was. Over the last week, and quite a bit over the last 2 days, we have reached out to our partners in the business community, regional municipalities, and representative groups like our senior center operators. We have heard a variety of perspectives on whether to implement our own restriction exemption program and what type of restrictions, if any, they would like to see. The Business Improvement Area Council of Edmonton, representing 13 BIAs, told us that they cannot, quote, support a council motion to introduce a vaccine passport system or rep at the municipal level. Explore Edmonton ran a survey with their stakeholders, which includes businesses, attractions, hotels, festivals. In it, 36% of respondents supported keeping REP and 40% supported ending it, which demonstrates in often cases the 50-50 split on this in terms of people's perspectives. Chief administrative officers of the regional municipalities around Edmonton have been working and exchanging information with us and amongst each other throughout the pandemic. We spoke with them and they are all planning to align their regulations with the province. And at this time, they're not formally considering municipal restriction exemption programs. Last night, Strathcona County Council voted to remove their face covering bylaw altogether in conjunction with provincial stages. Another sentiment we heard clearly from businesses was that the burden of administrating and enforcing the program would rest with those frontline workers, staff, and servers. The GBA Plus lens tells us that enforcement measures will put frontline, retail, and service workers at risk of violence, abuse, aggression, racial slurs, and potentially hate crimes. This risk is increased for racialized individuals, women, and gender, sexual, and romantic minority individuals, and business owners. Businesses have indicated that they have very little appetite to continue enforcing restrictions, especially if they differ from those for other businesses across the region. And businesses are wary of unwanted confrontations with frontline staff who have limited or no enforcement training. It is expected that if a bylaw is enacted, it could result in more public division. We anticipate that there will be a significant number of complaints that will need to be investigated. Municipal enforcement officers in Edmonton Police have limited resources to enforce REP bylaw, so it would end up being led through a complaint-based system rather than proactively canvassing all the 4,000 eligible businesses. Enforcement officers would need to perhaps redeploy from other city priorities to do these investigations and respond based on what we believe the expectation of businesses would be. Alberta Health Services, who have the power to close a business under a health order, will not be enforcing these rules any longer, and so we lose that aspect of the enforcement with the changes in the provincial rules. If a municipal restriction exemption program is implemented, private businesses in the City of Edmonton recreation facilities may see clients visit neighboring municipality facilities. If not implemented, however, it is unknown if those in support of a system or a REP will stay away from our businesses and our recreation centers who do not check for vaccination or negative tests. What we do know is that inconsistent rules between municipalities can be confusing and frustrating for staff and customers alike. We don't know enough about consumer behavior for vaccinated and unvaccinated segments of the population, and we cannot presuppose that one type of business may see an increase or a decrease when faced with potentially confusing or conflicting regulations. It's important to remember, however, that any business may choose to implement their own version of a vaccine check in the absence of a city-led restriction exemption program. Businesses that would be bound by a municipal restriction exemption program would incur costs to administer such a program and would also need to ensure they are complying with the conditions of a formal bylaw. If that were the case, City may want to consider funding to help businesses implement the program. When we talked with business improvement areas, they expressed that should Council decide to proceed with a bylaw, they would strongly hope the City would provide some funding. Just as a comparator, the provincial government provided $2,000 to all eligible businesses and provided training opportunities for businesses in their rollout of the program. Now, in our case, it's not like rolling out a whole new program, so we don't think the cost would be the same. If Council was to apply a restriction exemption program at public-facing City of Edmonton facilities, these facilities will need to continue approximately about $120,000 a month that is being used right now for compliance and safety and security of our staff and patrons. But that is an ongoing cost that we are doing now. And this is based on our past experience with these programs over the last year and a bit. In addition, we estimate that we may incur a further one-time expense for a QR code verifier app that meets regulatory requirements if the provincial app does not continue to function. We think that is somewhere in the order of $120,000. Just a bit more on the GBA Plus lens. We consulted with our senior association operators at city facilities to discuss how the change was impacting their members. One of the senior associations was no longer checking vaccine status to reduce confusion with their membership. Another senior association had decided to continue to screen on vaccination status and evaluate whether to continue checking after consulting with their membership. ongoing barriers for some populations to access technology required for QR codes, such as seniors, homeless, houseless population, and English language learners. These populations may be turned away from establishments. We have some evidence from the onset of the REP that showed that houseless individuals could be negatively impacted by the necessity to show proof of vaccination, whether it was by a printed paper copy or through technology. Social service agencies and libraries have assisted this population in obtaining necessary documentation, but due to damages of paperwork or inconsistent ability to charge technology, individuals were being turned away for service at coffee shops and some hospitality locations because of the REP program in those instances. Through the motion on Wednesday, you also asked administration to explore active symptom screening as a way to help protect Edmontonians from COVID-19. After strong consideration, administration is also not recommending an active symptom screening program be put in place across the city. We implemented this step in city recreation centers based on our own occupational health and safety obligations as an employer to protect our employees and patrons in our facilities. And we're going to continually assess the effectiveness, resourcing, and compliance with this program to see if it needs to continue. We do know that active symptom screening reduces transmission by emphasizing that everyone must be feeling well when they attend a facility. And each individual Edmonton business can choose to take part in this screening if they choose. They do not need a bylaw to do this. The provincial public health order requiring isolation if a person has experienced symptoms or tested positive for COVID-19 does remain in place until step 3 of the province's plan. It legally requires an individual to stay home if sick, and businesses can restrict a person who is experiencing COVID-19 symptoms from entering based on this legal order. No further bylaws required by the city for a business to take this step. In fact, many businesses, such as dentists or doctors' offices, have already taken this active screening requirement in place and through a form that must be completed before a person attends their appointment. Implementing a bylaw would require each business to have a screening process for their establishment. For some businesses, they may take the form of a screener at the front door, confirming with each person who enters that they do not have any symptoms of COVID-19. Such a bylaw would be an added expense for businesses to administer and would have many of the similar considerations that I spoke about on the last slide and the example of the REP. Just like a municipal restriction exemption program, it would also create regional inconsistencies in Edmonton and regional businesses. Instead, we suggest that businesses remain free to implement what works for their establishment to meet the needs of their customers and employees. It may be active screening or it may be passive screening, like posting a sign at all entrances to the premises of the business, or the organization that informs individuals on how to screen themselves for COVID-19 prior to entering. This passive screening practice is currently being utilized in Ontario, and ultimately we have heard from businesses that they do not have the energy sometimes to implement new restrictions. Now, I want to be clear that if directed, we are prepared to table 2 bylaws that we feel capture the right intent and provide direction to Edmontonians and businesses. We thought Council may want to first consider administration's recommendations before we formally table bylaws for debate. Implementation of the bylaws would essentially look like this. The REP and/or active symptom screening would be required at applicable businesses in the manners in which I've described in different scenarios. REP would be implemented in city facilities, as we already have people doing active symptom screening in places in our recreation facilities. And the enforcement of these rules would occur through frontline staff and a complaints-based system investigated by municipal bylaw officers and police, but without the possibility or of any AHS enforcement. Now, on temporary mandatory face covering bylaw, for the time being, we recommend the city's temporary mandatory face covering bylaw remain in place with no changes. We recognize that this will create some inconsistency with provincial regulations starting February 14th for those who are 12 and under in this city. The city's bylaw currently requires anyone 2 and older to wear a face covering in indoor public places. We are prepared to continue to monitor this and return to council with recommendations in the coming weeks if we feel they are necessary or if council would like us to. It is important to note the City of Edmonton's face covering bylaw does not apply to schools and other educational institutions, hospitals and healthcare facilities and childcare facilities. Although we have heard in the last day that some universities are going to continue with the mask regulation. We understand that speed of provincial changes has caused concern for Edmontonians and for this council. We know that your concerns are about protecting Edmontonians, and that's part of the reason you asked administration to return with program options. Our recommendation is to not implement any form of bylaw. We believe that they will not achieve the desired results, but rather create confusion and concerns. As we talked about on Wednesday, Edmontonians can still take action to protect themselves and their neighbors. The public health basics we have repeated for 2 years. It is through getting vaccinated, monitoring ourselves for symptoms, staying at home if we feel unwell, that we'll be able to reduce transmission of the virus in our daily lives. We are here to provide our best advice using the facts and insights we do have, and we don't have all the facts. And once you have provided direction, we stand ready to implement diligently any option that you want us to proceed with. We recognize the situation is complex and the circumstances are difficult. And I really do want to echo the Mayor's comments at the outset of this, that I just want to personally thank all the staff that have been up all night in some cases, working through this, and some of our staff who have been working this problem for well over 2 years now. So thank you very much to the staff for all that work. And with that, I'm happy to take your questions, and we welcome any direction you want to give us. Thank you.
Thank you, Mr. Corbold. And once again, thank you to all your staff and everyone who's been involved. And I'll go to council members for questions. And Councillor Paquette, you're first.
Yeah, thank you, Mr. Mayor, and thank you, Mr. Corbold, for that report. I think it's in line with what most of us assumed would be the answer, but I think it's extremely important to show Edmontonians our work on this so that they can see that we've done our due diligence and that we're reporting based on the facts in front of us. So one of the questions I have is, oh, by the way, I would be remiss in also not mentioning the extremely hard work that people have put into this over the past few days. And as you said, Mr. Corbold, over the past 2 years. So my question is, there are going to be some questions from components of the business community who are saying, well, we feel that it's in the best interest of our business and the health of our employees, so we don't have to shut down, to have some form of REP. Failing, due to the realities in your report, what do we say to those folks about the support they can expect on either, basically on a municipal level, which I think is probably slim, but we should have an answer for them.
Yeah, thanks, Councillor, for the question. I mean, obviously, different businesses have different perspectives on this. So I think the reality is that as a private business, they have not only the obligation, but the right to protect their employees in the way that makes sense for them from an employer perspective. And they have the support of occupational health and safety codes to do that, and some of the regs to do that. So they're certainly within their rights to put in place precautions, as this city has in our recreation facilities. We instantaneously did that when REP was rescinded by the province, and we felt that was the best choice for us, and I think the city is doing that. We will continue to do that, and businesses have the same right to do that. We could certainly work with them. We can share our experiences, and we can share our protocols, and we have done that throughout the last 2 years as well, and that's been helpful to some of them, especially smaller businesses. And we're happy to put those kinds of services to help businesses where we can.
Yeah, it's tough questions. All right. Well, in light of this, to help focus the the questions, Mr. Mayor, I would put receipt of information of this report on the floor.
Second.
Uh,
And that way we can focus around it and then move on to whatever subsequence there may be.
Okay, well, I would have preferred everyone to have a chance to ask questions first.
I'm pretty sure that we don't have to go to a vote. Everyone can still ask questions as they were. It's just a formality.
Okay.
But if you prefer not, of course.
That's fine, that's fine.
Okay, thank you.
Are you done?
Yes, thank you.
Councillor Knack?
Thank you, Mr. Mayor. And again, thanks to administration for your tireless work on this over the last few days and well, of course, for the last couple of years. A few quick questions. Just to confirm, we didn't receive the provincial government's response. They didn't respond to council's request for information. Is that correct?
I believe the mayor's letter has gone out. I do not believe we have received a response, to my knowledge.
Letter has gone out today, so.
And sorry, Mr. Mayor, you didn't receive anything?
No, I'm sorry, Councillor Knack, letter has gone out today.
Well, and I think, and no need to apologize. I know it was sent out, and it's not your fault that you didn't receive a response. I appreciate you putting out the request.
Yeah.
Similar to Councillor Paquette, I agree. Appreciate the recommendation. While I have concerns broadly about how we're handling this, I see from a city perspective that's likely the direction. Dr. Secor, just a few quick questions for you, since we have you for a little bit here. I think during the last meeting, you talked about how it's reasonable to potentially remove this program, especially as currently designed. I just wanted to get a sense that I think if there was going to be any attempt to try to do something, sort of setting aside the practical argument, which I think is very valid for us, you would have to do it including the booster, would you not? I mean, that's the only way you would have an effective tool at this stage.
I think that's correct, Councillor Knack. An REP program in its evolution would have to encompass all recommended immunizations as per age, as other medical conditions going forward. And that would be an ever-changing environment into the future.
Okay. And I know these questions might sound silly, but you know, we've been inundated with emails from a particular organization the last 24 hours, or at least I have. I can't speak to my colleagues. Many of which, you know, have suggested that there have been no public health benefits from any of the public health measures that have been put in place over the last 2 years. And I guess I just want to ask, is that your interpretation of the public health measures over the last 2 years, or has there been a benefit to the public health of folks through the different tools we've used over the last 2 years?
I certainly do believe, and I believe the evidence also shows that we have had a profound public health benefit to our interventions over the past 2 years. One of the pieces of evidence that I might point to is that we did not have a substantive number of influenza cases, which does show that the hand hygiene, the physical distancing, immunization, masking, and that 2 meter distancing between other individuals does work. It does work to stop transmission and reduce transmission of respiratory viruses, influenza, that we do have fairly good, really good data on, but also COVID-19. So our intent over the past 2 years to decrease the peak or flatten the curve, as the mantra was about 18 months ago, have been actually very successful. And they continue to be very successful in helping preserve and reserve our hospital infrastructure to be able to respond across the board.
Perfect, thank you. And even today, you know, I think there's charts on the provincial website around the per capita death rate between those who have received the vaccination and fully boosted versus those who haven't been. There is still a would it be true to say there's still substantial benefit to getting vaccinated, getting a booster in terms of experiencing less severe outcomes?
There continues to be exceptional benefit in receiving the immunization as your time comes available, based on your own personal circumstances, whether that be medical comorbidities, increased sensitivity, age. Reducing that severity, need, or possibility of hospitalization is, of course, a primary concern, but also Having that immunization makes you less likely to be ill, and ultimately also less likely to transmit the disease and illness onto other individuals as well.
And generally speaking, that would still apply even with this current variant in terms of those broader public health benefits, correct?
That is true. That is correct. That benefit extends even in an Omicron wave, and will extend into future COVID waves that we may see, or other respiratory pathogens that our population and our communities may face.
Thank you. Do you still feel, I think, as we do talk about this learning to live with COVID, we talked about it last time, there were even just 22 deaths reported yesterday. Is it still serious? I mean, should we still be treating this virus seriously?
Our population has taken the opportunity to be protected with immunization. So we have nearly 90% who have chosen to have 2 doses, and that's good. So we have made decisions as communities to take those opportunities to be better protected and better enabled to be able to protect ourselves, our loved ones, our workplaces, our schools, and our cities from the poor outcomes of COVID. COVID still is a serious disease. It still does land people in our emergency departments, our hospital wards, our critical care environments, and can lead to mortality and death events.
We are trying out of time, but appreciate that answer, Dr. Sikora. Thank you.
Yeah.
Thank you, Councillor Knack. Councillor Salvador?
Thank you, Mayor Sohi. And again, just want to really thank administration for their work on this, such a short turnaround. But I mean, not only that, I mean, it's been 2 years, and want to express that and that gratitude. I guess for Mr. Corbold, I'm very aware of the short window that was provided for engagement. And I'm just wondering, beyond the business community, were we able to connect with, seniors organizations or folks who might be vulnerable to COVID-19?
We did connect with the 2 associations I mentioned in my briefing, and of course we got 50-50 response in the meantime for them. But one of them is checking with their memberships as well. We did not, in the 36 hours we had, do much of a consultation with vulnerable people. We did check in with a few agencies and got some sort of understanding, and I tried to summarize that as best I could in the GBA Plus analysis, but it was very difficult, I must say, to get a real fulsome consultation. And I believe Council saw some of the letters from the Chamber, the BIA Council, and other groups. So we've used all of the data that we have seen in the last 36 hours, yeah.
Yeah, absolutely, and completely recognize how short that window is and how there wasn't much, much info on our end.
I would say also, though, that we have been doing GBA Plus analysis on our response to the pandemic for 2 years. So some of what we are bringing forward is coming from, we did have quite a lot of consultation with agencies who were dealing with houseless people and helping them. And so that previous consultation did come into play in some of our recommendations.
Okay, great. Thank you for that answer. And then to Dr. Sikora, I'm just wondering, I just want to pick up where Councillor Knack left off around sort of the evolution of an REP program for incentivizing vaccinations. And I guess my understanding is that right now for 3rd doses, whereabouts are we in terms of uptake, in terms of population?
Sir, I don't have those numbers immediately at my fingertips.
Okay, I guess my understanding is that it's still fairly low, and I know we did see a pretty significant bump from 1st dose to 2nd dose when REP was implemented, and I guess would we anticipate to see a similar bump from 2nd to 3rd dose, or what are your thoughts on that? I'm just trying to understand the relationship there.
So and 3rd dose was sequenced in a particular way. It did stage along individuals that were of increased sensitivity or with increased medical comorbidities, those healthcare workers being other major categories. So it can be quite variable. The province had made decisions with the ARP that a full course or a full course of COVID-19 vaccine would be typical, or a vaccination series would be defined as 2 doses as per the vaccine manufacturers. 3rd dose or booster dose is variable depending on what your category is. So others may, well, if individuals chose to get a vaccine series because of REP, I'm not sure of their willingness to get a booster or a third dose if none of those incentives perhaps were present. And I think our provincial government would have to explore what incentives might be around booster doses or third doses.
Okay, thank you for that. And just with the last minute here, I recognize that, you know, there is a risk that customers and patrons might stay away from businesses in the absence of this type of program. Again, thinking about, you know, compromised folks, seniors. But Mr. Corbell, you did mention that businesses could choose to administer their own programs. And I guess I'm trying to envision what that would look like. Is there an easy way for the city to support their transition if they were to adopt a program like that? How do we see our role in helping facilitate that sort of more independent approach?
Yeah, I would say.
Oh, I think you're muted.
Sorry. Yeah, I would say again that we can certainly share our protocols and what we've been doing during REP and what we're doing now with our symptom checks. We're happy to share those documents and some of our policies and procedures. We know that previously the city, throughout the last 2 years, when the city has put out publicly our policies and procedures, lots of businesses and other organizations have used those to formulate their own. So we will continue to offer those examples and supports. Short of specific funding, which is not in a program right now, I think it's that kind of thing, and certainly answering questions and helping with 311 calls and inquiries on how one might set up something like that in a small business. We're happy to help with that.
Okay, thank you. I'm out of time.
Thank you, Councillor Salvador. Councillor Tang.
Yeah, I echo all my colleagues' word. Thank you all so much for this. Well, what a time we're in. Thank you for all the hours and also emotional labors that you're bearing personally and your conversations with partner organizations. Just, I guess, building on the theme of seniors, wondering if there's been conversation, or do we know if, you know, long-term care facility, continuing care, will they be continuing on with specialized protocols at all?
My understanding, Councillor, is that changes in stage 2 and 3, but I'll see if Dr. Sikora wants to confirm.
I can just rephrase that, I'm sorry.
Just in terms of the long-term care, continuing care, those kinds of facilities, will they have specialized protocols, you know, in parallel?
So our current protocols and protections that are in place with the long-term care, continuing care facilities stay as is, and that's things related to single-site expectation, protections, hand hygiene, continuous masking, and eye protection. From the roadmap that was communicated by the province on Tuesday, those would stay in place until step 3. But again, the details of that aren't quite available.
Yeah, no, thank you for that. It's good to know some of those protocols will still stay in place. Just in your conversations, Mr. Corbell, did issue of capacity limit come up at all? I know it wasn't explicitly in the motion, but wondering, say, for restaurants, for example, will, you know, are business interested in keeping some of that distancing measures in place too?
It did not come up in any of my conversations. I'll see if Ms. Poirier wants to add anything to that.
Yeah, thank you for the question. No, it's not one that we asked specifically, but like many of the pieces around a screening, whether it's for symptoms or REP, businesses could choose to limit their capacities if they wanted to.
Okay, thank you. One of the major feedback I'm hearing a lot from the residents in the ward is just concern for children, and also this inconsistency, as you pointed out in your presentation, when it comes to masking. And also just concern for the frontline teachers and, you know, staff who are going to be less protected. I guess, I don't know how to phrase my question, but just wondering if you can share a bit of a discussion around, you know, if you're talking to schools, you know, what are people feeling in terms of the impact of that inconsistency?
Yeah, thanks, Councillor. I mean, we did think a lot about this. In the end, we thought if we keep our mask bylaw the way it is, which means it applies to children, then at least they're wearing them on their way, and we can't control what happens in a school and other facilities, but at least we're doing that. I have noticed that some parent school councils and some parent groups have started work together and are encouraging mask wearing in schools, because with the change in provincial rules, it doesn't mean you can't wear a mask in a school as a child. It just means you don't have to. So I am seeing some, and I must say it's anecdotal what I'm seeing, but it is groups that are doing that. So I think I know our perspective at this point was, let's keep it as it is for now. Let's watch it closely. At least that does provide protection for children in public places in the city.
Yeah, great. Thank you so much. To Dr. Sikora, I think a lot of the measures that we've been talking about is very much individual behavior, but I'm thinking a little bit about infrastructural modifications, including the one that the school board recently implemented when it comes to air filtration in a classroom. Is the evidence strong on that in terms of the effectiveness?
It's a great question, Councillor Tang. It's variable and very much dependent on the environment that individuals are in, and for how long, and what kind of air handling is present. In many of the recommendations, there's a blanket statement that does indicate that it's an important factor. Having fresh air, having circulation is going to be important overall, but it's so site specific. Many of these locations would have to have a look with their air handling engineer, their HVAC expertise, to be able to structure to be able to best identify and structure a way going forward for that particular environment. It's very challenging for schools and for many businesses and locations.
Great, thank you for that. In my last 10 seconds, my last question, will the city and the AHS continue to promote, with marketing materials, communication for booster shots and all of that? Just yes or no is good.
Yes.
Okay,
Yeah.
And I know AHS is yes too.
Okay, thank you. That's it.
Thank you, Councillor Tang. Councillor Wright?
Thank you very much, and I'll just echo the gratitude that I think we all on council want to express to administration and everybody that's put in so much work over the past couple of years. I'm just wondering, Ms. Plouffe, if I could ask you just to confirm that and I know it was in the presentation or I think it was in the presentation, that we do currently have the authority as a council to enact such a bylaw. Is that right?
That's correct, Councillor.
Okay. And what authority does the province have to, or what ability does the province have to rescind that authority as that they've done with the school board's authorities in regards to the masking?
Right. So further to emails you might have seen or maybe haven't seen from me, but they have been sent. The province has the ability to either change the MGA, Municipal Government Act, outright, and it has the ability to make a change through regulation by way of an OIC. So essentially, that would be a very specific block on the city council to pass a bylaw in this space.
Okay, so the ordering council, does that have to go before the Legislative Assembly for debate, or is it just something that they can do with sort of a private in-camera caucus meeting?
Yeah, that would be through cabinet. That's correct, and it need not go through the legislature.
Yeah.
Okay.
Cabinet decision, and then signed by the Lieutenant Governor.
Okay. So we wouldn't be privy then to, or the public wouldn't be privy to their reasons or rationale for that, right?
That's correct.
Okay. And then, so then my other concern with that, so if, with the swipe of a pen, they take that authority away from us for this, for a vaccination passport bylaw, where does that leave us in regards to other bylaws that we might want to exercise that authority to for the safety and the health and the welfare of Edmontonians?
Well, I would say, Councillor Wright, the analysis is the same. What we're talking about is a very specific set of bylaws. The analysis would be the same for virtually any area you want to set a bylaw in.
Okay, so we would not have the ability then to put forward bylaws in regards to safety in transit or things like that, right?
So going back to the analysis, you absolutely have the ability to pass those bylaws. Now, they're very unique circumstances for the province to take a step to block those types of bylaws. I have not seen it used. That's not to say it hasn't been, but that would be extraordinary. My take.
So, sorry, I just want to get some clarity on this. So if they could just sort of strike down this one bylaw and we would still have the ability to put forward other bylaws for, again, the safety, health, and welfare of Edmontonians?
Yes, that's my take. Yes.
Okay. Okay, but I mean, they've done it to the school board, so they could do it in this case.
I would say that comparison is very different because school boards have very different regulations and legislation in terms of where the authorities are derived from. So.
Okay, just in my last minute here, Dr. Sikora, in your presentation from earlier this week, or I think that's when it was, you'd indicated it states 90% or almost 90% of those 5+ have their vaccinations. How much of the population is under 5 that don't have that option to have the vaccination?
Again, I don't have specific numbers on what percentage of the population, what our population number is under the age of 5.
Okay.
We'll see if we can get that information for you, Councillor.
Okay, thank you. And then with the almost 40% vaccination of, again, the population over 5, if you haven't gotten the booster has better efficacy than just 2 doses, right?
That is correct.
Yeah. Okay, so my time is up. I will come back. Thank you.
Thank you, Councillor Wright. Councillor Stevenson.
Yes, thank you. Well, maybe I'll just follow the thread of my colleague. So, sorry, when we're looking at the vaccination stats, the close to 90%, is that 5+ or is that 18+ or 12+? Is it, yeah, what's that benchmark?
I believe that's the eligible population, so 5 and above. I believe, sorry, that's 12 and above have with 1 dose, 86.3% 12+ with 2 doses. And that's 75% of the total population with 2 doses.
Okay, and so do we have the vaccination rates for the 5 to 12?
5 to 11 with, just give me a second.
Well, you know what, I can come back to that because I wanted to ask some other questions that we'll loop back to that if that's all right. I'll give you a few moments to pull those numbers up. I appreciate it. What I'm struggling with in this conversation is that on the door, well, I'm struggling with many things in this conversation, but what's been hard is knowing this summer on the doors, hearing from so many Edmontonians how grateful they were to our city for showing leadership and for taking measures to keep Edmontonians safe. And I feel that we are no longer doing that. And that's what I'm struggling with. And I'm just wondering, Mr. Corbould, if you can talk me through that in terms of what we can speak to in terms of the work that we're doing. So keeping masking in for 2 and up. Do I understand that the plan is to continue screening at city facilities?
Yes, we think that's working well in the first couple of days. We'll continue to do that. The mask bylaw would carry on. The continued use of masks on transit is very popular with our ridership, and as we've consistently heard. And then I would just say that all of our decisions have been based on, you know, the advice we're getting from Dr. Sikora and Dr. Hinshaw and others. In this case, I think what's a little difficult is that we have less data than we had before. We don't have, you know, good data, for example, on testing right now because of where we are. So that does create a bit more of a challenge for us to provide you advice in a leading way. But
Sure.
we are doing, I think, lots of really positive things in the city. We've also talked about, you know, we're happy and always ready, willing, and able to help set up a vaccination clinic, for example, using city resources. But the reality is, you can get vaccinated almost anywhere in the city right now through a pharmacy. So there's really no need.
Well, yeah, and I think that comes back to the question I want to circle around with Dr. Sikora. But before we leave there, I think I'm just feeling a bit of dissonance in terms of our decision to screen at our rec facilities, because we believe that to be the safest OH&S approach. So if we believe that screening is that important OH&S approach, what I'm hearing is that even though we think that that is the right thing to be doing, we just don't have the resources to implement that on a citywide basis. Is that fair? It's not that we don't think that screening is the right thing to do, it's just that we don't think it's practical to do.
Yeah, I think it's, from my perspective, it's one thing to, you know, we as an employer do what we do in our city spaces, but to impose that on other employers, I don't think is necessarily what we need to do. They all have their own responsibilities, and we employers make our decisions. And I also, you know, don't know how long that we will need to continue to do that, and we'll watch that very closely.
Yeah, and I think that that's just sort of in the absence of some of the other practical tools that we have to promote health and safety with Edmontonians. I'm just wondering if there's work that we can be doing around our messaging. And so I don't know if that's a question for Ms. Owen, but just in terms of messaging that you know, we as a city do think we should be looking out for each other, that we should be screening, that we're providing those resources. I mean, back to that, I think sharing documents, policies, posters as widely as possible with private businesses so that they can choose to implement their own programs, I think is one way that we can continue to show leadership.
Whatever the decision of council is today, we know that there'll be a communications program to convey that information to Edmontonians and to Edmonton businesses, and we have made packages available to them in the past, and we do so again.
Thanks, out of time.
So just to follow up with some of your questions, we have about 270,000 residents in Alberta under the age of 5 or 5 and under. And our immunization with one dose for the 5 to 11 has been 46% across the province. For those who have been 5 and above, there's about 4.1 million Albertans, and 80% of that population, 5 and up, has received 2 doses.
Thank you, Dr. Sikora and Councillor Stevenson. I'll go to Councillor Cartmell next.
Thank you, and I too want to echo profound thank yous and gratitude to administration. This has been an extremely difficult and demanding week, and particularly the last 2 days. So you have our gratitude. This is not easy. It's not easy for anyone, and we really appreciate your efforts. I really only have one question. I asked a lot of questions the other day, and I'm comfortable with the answers I received. Mr. Corbould, with respect to our face covering bylaw, is there not a trigger that if the province essentially removes that restriction, that we trigger an automatic conversation at council? Was that not something we moved not too long ago?
I think what was moved not too long ago was a need to come back to council for discussion periodically. So I don't think that's the trigger, but we have lots of triggers to come back to council. And so I'll just see if Ms. Plouffe wants to clarify, just so we're super clear on that.
Yeah, just to clarify, Councillor, that is not one of the triggers.
Is it? Okay. I just wanted to, I'm sorry, I just wanted to verify that or otherwise, so I appreciate that, thank you.
And one other thing on that, one of the triggers has to do with 100 cases per 100,000, and we're working through that now because I don't think we'll know when we get that. I know we're a long way off today, so it's not an imminent concern, but I'm not sure we'll be able to tell council when we hit that trigger. So we're looking into different ways that we can re-examine that, but it's not urgent.
So I thought we had both triggers, the 100 per 100,000 and a provincial action. But you're saying
Sorry, Councillor, you are correct. I was misunderstanding what you were asking. You are correct. They need to be both in place to basically force council to come back for a review. So you are correct. My apologies, I misunderstood what you were asking.
So it's a both, not an either or.
Correct.
I see. Okay. Thank you very much.
I do suspect we'll be coming back to council well before we hit any of those triggers at this point, just because we need to think about other ways of doing that.
Thank you, Councillor Cartmel. Councillor Jans?
Thank you. And my question is for Dr. Sikora. What is the harm in waiting for another month to continue the REP and or other public health protections until after Premier Kenney's leadership review?
So thank you very much for the question, Councillor Jans. The other public health measures continue to be in place. Things related to the hand hygiene, staying home when you're sick, use of face covering, gathering size limits, environmental cleaning, isolation orders all remain fully in effect. The only two changes that had been put forward by our provincial counterparts on Tuesday were removal of the restriction exemption program and the adjustment of face coverings for school-based environments. So that those are substantively the only two changes. The rest of the public health interventions, including isolation orders, testing requirements, or testing needs and capacity, have all been maintained fully and are expected to remain until our state step 2, which is proposed at least at the end of the month. So I'm fully confident that the public health measures that are in place and continue to be in place will have their effect of helping reduce transmission and reduce burden into the hospital infrastructure.
Right. So you mentioned earlier about a third shot would be much more impactful against Omicron. Do you believe if the province updated the REP to account for a third shot, it would provide an effective nudge? Because I personally don't think at this point that education is the barrier here. I think having we've seen through the REP program that it has successfully led to greater immunizations. So wouldn't adding a third shot to the REP, would that not be more successful at increasing our outcomes?
I think it's a very interesting proposal, and I wonder if those were some of the discussions that had happened at cabinet.
You're not aware?
So I'm not aware if they have or not, or if that was part of their considerations.
I was wondering if you had seen, I believe it just came out, there was a letter of condemnation from the University of Alberta School of Public Health. A number of doctors and independent public health experts condemned the government for 3 reasons: the slow uptake on boosters, the lagging vaccination for 5 to 11-year-olds, and the ineligibility of under 5-year-olds to get immunized. So it seems that independent health experts are really condemning this move and urging the city and others to do whatever we can to keep people safe. If I understood you correctly, hospitalizations have plateaued at the moment, but there still is the opportunity that by removing any protections, that we could be well into a worst summer ever all over again.
I don't know what the future is going to hold, Councillor. Our hospitalizations, even since Tuesday, have dropped, which is good. Our wastewater surveillance is still continuing to trend down. What I have observed from our provincial counterparts is that they are following the best recommendations and advice from the National Advisory Committee on Immunization regarding immunization of 0 to 5, and with the enhanced addition of immunization for 5 to 11 and 12 to 17 for those with medical conditions has been well adopted, and adopted because of the recommendations of our national body. Other provinces have elected to do different, but Alberta is strongly following the recommendations from our national counterparts and advisory bodies.
So are these the recommendations that Dr. Hinshaw made to cabinet?
I don't know if they were the specific recommendations Dr. Hinshaw had made to cabinet. It's an observation that the recommendations, or at least the policy changes specific to immunization that Alberta has adopted, do fall in line with the National Advisory Committee on Immunization.
I was reading a study about where vaccine misinformation comes from, and a majority of it is from social media companies. I think while we may disagree on the efficacy of this latest round of changes, I think you and I would both agree that greater action needs to be taken against social media companies that are profiteering off of spreading vaccine misinformation. Do you want to talk a little bit about what we've? Do you want to talk a little bit about what we've experienced here in terms of misinformation about vaccines?
Councillor Jans, I don't think that is actually the expertise of Dr. Sikora. He's a health professional. I don't think he may have an opinion on it, but I don't think he can provide you expert advice on that.
Sure. Well, I'm out of time. Say bye to Mel.
Actually, Mayor Sohi, if I might respond.
Yeah, go ahead. Yeah.
Councillor Jans, it is very important. I think what you've highlighted is something that something that the World Health Organization brought forward in the first weeks of the pandemic, and it was the notion of how this will be an infodemic, or a pandemic of bad information, or pandemic of misinformation. We have struggled with this, and every health jurisdiction, every province, every nation has struggled with this everywhere. So our Alberta experience, or Canadian, North American experience, is no different than others.
Yeah.
Finding good, credible sources of truth for good information is something that we all strive to do. We all do strive to speak with fairness, to be able to acknowledge when we don't know something, and to be able to advise based on risks and benefits, both to individuals, to families, to parents, to schools, to institution organizations, our cities, our province, and other decision makers along the way. We don't have all the answers.
Yeah, thank you.
But we do strive to develop those answers, build the tables where we can get answers that are going to be most beneficial to our respective populations.
Yeah, thank you, Dr. Sikora. Councillor Rice.
Thank you, Mr. Chair, and I would like to thank you, administration, for this great work and two recommendations with very clear rationale behind, and also detailed analysis for the implication. And so I really don't have lots of questions, and because my questions answered by the two recommendations, I just only have one confirmation question. Is regarding the recommendation 2. So administration does not recommend the implementation of bylaw require like business for the active symptom screen. Is that safe, and is also certainly too safe for us to say we are now, and our business, we give that opportunity to our business, and they can do their own and screen attendance and without a bylaw. So we don't need to have any bylaw in place for that.
Yeah, that's correct, Councillor. And maybe just a couple of reasons behind that is we feel it's a little different because it is about each individual employer's occupational health and safety plans and procedures. And we also heard from the business community that they didn't want a bylaw even like this. We do think it's safe to do as we're doing, and one of the reasons we think that's helpful is because it's backed up by a health order that does still say that people should not be out in public if they have COVID symptoms, and so that's what supports that carrying on. And the health order already says that, and so implementing a bylaw would in some ways be duplicative of the health order, which says you shouldn't be out in public or those kind of spaces if you have symptoms.
So that actually is great. And because last night I just went to one business and then the business owner and then expect exactly what city right now recommended. And I just want to share that. And so get that clarification. Thank you. So one more question regarding for today's discussion. I just wondering, is it only for us to discuss REP, or we still have opportunity to discuss the mask bylaw?
Yeah, just on mask bylaw, our current recommendation is it remains in place as it is, which is to say that you have to wear a mask for ages 2 and above in public places, and we think that's the prudent step to take at this point in time. And as I indicated in my briefing, if council would like us to revisit that at any time, just let us know. And if we feel it needs to be revisited, we will get it onto an agenda for consideration by council.
Okay, thank you. That's all.
Yeah, thank you, Councillor Rice. Councillor Hamilton?
Thank you, Mayor Sohi. I actually, I've been listening really closely to the questions that were asked. I don't have any additional questions, and I haven't heard any answers from administration that don't support, I think, their recommendation. So I really just wanted to speak to it, if that's okay. So
Councillor Hamilton, you want to speak to it now?
Yes, I don't have questions. I just want to speak to it.
Okay, you just want to know, you want to speak to it now or you want to speak to it later?
I'm fine with speaking to it now.
Go ahead.
So like I said, I haven't heard any responses that don't support administration's recommendation. I absolutely understand that there are people who are concerned about the loss of the restriction exemption program. I understand the city's been put in a difficult position this way, but the overwhelming majority of feedback that I've received from residents, people who never reach out to their elected representatives, and these aren't mass emails and they're not angry emails. It's just a lot of feedback from people who are really tired, and they've asked me not to support this. And I think what's been interesting about that feedback is a lot of people self-identify as people who are fully vaccinated and believe in the efficacy of vaccines, and have believed in the restrictions thus far, but would consider that any further action on behalf of the city would be too far. And I know life is really hard for folks right now, but and I'm really empathetic to that. And I think we've heard this, that COVID's going to be with us and continue to be with us for a while, and it presents a lot of, I think, challenges, and will continue to present challenges to us as governors. But I think that I think the advice from administration is sound, and I don't agree that this is a program, or I don't feel that this is a program that we should implement. I think the advice has been really good that way, and that as a final point, that if we proceed with implementing something of this nature, I'm not sure. I think we might, frankly, endanger our relationship with the provincial government. And I think that we have a lot of collaboration ahead of us on issues around health and well-being and safety within our communities that we're going to need good faith conversations about. So I'm not sure that this is. I think that proceeding on a city-operated restriction exemption program would probably create a bit of a challenge with that relationship, and I'm not sure that it's something that we want to go forward with if we're trying to have that open collaborative relationship on some really big health and wellness issues. So I support the recommendation of administration, and that we receive this report for information. Thank you.
Thank you, Councillor Hamilton. So everybody has one first round. So Councillor Salvador, can you take the chair? Just one few clarifying points that I need from administration. Good, thank you for that. So one of the reasons, Mr. Corbold, the provincial REP program was successful because it has the force of the law behind it, the force of the health measures, right?
Yes, Your Worship, and quite often, I don't know the specific numbers, but we do know AHS, based on that health order, was enforcing that, and from time to time gave warnings and closed down restaurants and things like that, which we wouldn't be able to do with our program.
So because we won't have that authority we don't have that authority, but even the health services won't have that authority either now, right?
That's correct.
Okay, all right. And also the one thing that I'm really worried about is the pressure on frontline workers. And these are the young people. These are young people, and working in the restaurants and bars and pubs, even our recreation facilities are mainly young people working on those facilities. So I really worry about the impact on them.
Yeah, I think we do too, Your Worship. You're talking about generally 17 to 22-year-olds in a lot of these frontline positions in bars, restaurants, and recreation facilities, or lifeguards and folks like that. And while I think it was pointed out on Wednesday, employers definitely are obligated to protect those employees, and I think we can really protect those employees from any physical harm, but it's hard to protect it from the psychological harm of some of the reactions you get. I can't unhear things for employees and things like that. So I do worry about, and we heard from our own employees that, they really don't want to keep on doing this with rapid.
And with having a municipal REP program in place, there will be expectations from some patrons that businesses and their employees enforce the requirements, and that puts employees in a very compromising position.
Correct. And part of our strategy for dealing with difficult clients on this has been that employees can tell them there's a public health order that says this. We don't have that ability to include that in our strategy going forward.
Yeah. And it's even more concerning at a time when this whole debate on COVID is so polarized, and some voices are really feeling emboldened. And we have seen that in our downtown during the last weekend and the weekend before.
I would agree.
Yes. Yeah, that worries me. That scares me, actually. That really scares me for the well-being of those workers. And okay. And those are the questions I had. So just quickly on the clarity on the mask bylaw. 2 triggers, right? Health mask bylaw from province being repealed, and 100,000 cases per 100,000 population for 28 days consistently below that, right?
Correct. And as of today, we're at 500 cases.
So we are not even near anywhere there, right? And so it will remain in effect unless we decide to do a different decision on that. So, okay, good. That I think that's a very important safety measure.
And just to be clear, those triggers are not to remove it. Those triggers are for council to have a discussion.
To have discussion. That's a very important safety measure that we will continue to enforce. Okay, those are the questions I had. And what I'll do, Councillor Salvador, is I'll move the second round.
Second.
Let's go to a vote for a second round. Please display the vote. That is carried. Thank you.
And if you could keep the chair, I just got to step out for a minute.
Yep.
Thanks.
We'll just wait for the list to come back up here. Councillor Stevenson, please go ahead.
Thank you. Is Dr. Sikora still with us?
No, he has had to depart, Councillor. He could only stay till 2:30.
Okay. Well, yeah, I think I heard from him that the 5 to 11 population is at a minority, so only 47% of that age group has had their first dose. Knowing that REP was the most successful program that we've seen, I believe, in increasing vaccination rates. I'm just wondering what the thoughts are from a city perspective of what we can be doing to encourage vaccination in that age group in the absence of a REP program.
Yeah, I would say again, is talking about it. It's leading by example. It's doing what we've done with programs. So I think we just have to talk and keep on doing it. And I would say that well before the REP program was put in place, there was a lot of successful campaigns and talks that did increase vaccinations and got vaccinations going. So I wouldn't say it was the only thing that got it going. We had lots of successful support for vaccinations prior to a REP. That certainly took it from I think 76 to an 86%, but it was well before REP that we went from 0% to 76%. So there are other ways, and a lot of those ways are by advertising and reinforcing the importance of it.
So I guess just in terms of that resourcing, the city is still committed to using our resources for that messaging, for that campaign. Ms. Owen, you mentioned that work would be ongoing, and just want to confirm that the resources are in place, that it's a broad, wide public messaging campaign that we have resourced.
Yes, and I'll just see if Ms. Owen wants to provide more detail.
We intend to stay on that course of encouraging Edmontonians to be vaccinated.
And other measures, I'm sure, as well. Just wondering as well, in our communication strategy, how we continue to, as a city, show leadership in recognizing that the pandemic isn't over, that it's shifting and altering, but that we still have work to do as a community to keep each other safe.
That's been an ongoing message of ours, that looking out for one another has been one of the key features of keeping Edmontonians safe. So we'll continue to reinforce that as part of a suite of messages to Edmontonians about the many things they can do.
And Mr. Corporal, just to get really specific, because again, I just worry about the signals that certain actions or lack of actions send. Yeah, I guess we're not removing REP. I guess again, I'm just wondering how our decisions today, how we ensure that they don't signal that that we're in the clear, that that ongoing measures aren't required.
Yeah, I think it's a good question. It gets back to how we've got to keep on getting the message out. And I think we signal that by keeping our mask bylaw in place, by keeping mask on transit, by reinforcing public health measures like washing hands and the other health orders that still are included, like not coming to work when you're sick and all those things. So I think there's a lot of pieces. And I would say that, for the last 2 years in COVID, it's never been one thing that has worked. It's been, the full suite of safety protocols to combat this virus. So we will full speed ahead on all those other things for sure.
Great, thank you. Those are all my questions.
I'll take
Thank
the
you,
chair.
Councillor Stevenson, and I'll pass the chair back to Mayor Sohi.
Thank you, Councillor Salvador. Councillor Wright.
Thank you very much. It's unfortunate that Dr. Sikora wasn't able to stay with us longer. So I'm wondering, Mr. Corbold, if you maybe have this data available. Dr. Sikora had indicated that the hospitalizations and ICU admissions have dropped in the past couple of days. And I'm looking back on the information that he provided us earlier this week that show hospitalizations and ICU were, have been steadily risen quite drastically, actually, over the past month. Hospitalizations from 264 up to 641 as of February 7th. And what I can find on the Alberta's website is just data for the Edmonton zone. And do you have access to that information as to Edmonton specific, what those hospitalizations and ICU admissions are right now?
I'll see if Ms. Poirier can provide. She looks at a lot of data. So
Okay.
Ms. Poirier.
Okay. And I'm also, the one thing that was missing off of his information was the number of deaths.
Yes, so perhaps I can help. So in hospital in the Edmonton zone today is 632, and in ICU is 59. We have to remember that the Edmonton zone is actually a catchment for all of the areas. Our
Yes, yeah,
hospitals as well.
I got that off. Yeah, thank you. I've got that information off the Alberta site. I was just wondering if you had any Edmonton specific.
I'll just check our dashboard if you can just give me a moment.
Okay. And while she, okay. That was quick.
And just with regards to zone deaths, it's 1,476.
Yeah, and again, I can get that off the website too. I'm wondering Edmonton specific, just for comparison purposes to the information that Dr. Sikora provided us.
Yeah, I'm just checking. I'll have to get back to you.
Okay, and Mr. Corbould, then while Nicole is checking on that, if you did have access, first I'll ask this. The cost and time commitment of our facility staff, is there a difference if they were screening or if they were scanning QR codes to check for a vaccine passport? Which would be more costly and time consuming?
I will ask Mr. Jevney or one of his people to comment on this, please.
Thanks.
Yeah, Councillor, the cost would be the same. We've just redeployed the people that we're scanning to do the screening. What our concern is, though, if we went to an REP, in some of those sites, we would likely double up the staff or bring in security to support those frontline workers. So the cost would go up. We're projecting, at least initially, in earlier stages of the pandemic, when changes were brought in, we did see a lot of incidents with those frontline workers, particularly around the time of the change. It sort of leveled off afterwards. So immediately there would be no difference, but we would staff up some of the facilities.
Okay, because to me it seems quicker to scan something than to ask a series of 12 or 15 questions. Okay, thank you. And do we have that other information on Edmonton specific?
Yes, so we only receive the information as it relates to the Edmonton zone, as our hospitals are in those zones.
Okay, yeah, and it's unfortunate. I was just wondering, hoping that Dr. Sikora would have been able to provide us if the drop in hospitalizations and ICUs were actually related to discharge of patients, or was it related to deaths? I recall Dr. You making a comment, I think it was back in the fall, that the drops in those numbers were related to deaths.
We can certainly ask those questions, Councillor, and get back to you. It's just Dr. Sikora had quite a few other folks to support today.
Oh, I'm sure he's a busy man, yeah. And Mr. Corbould, if you had more detailed medical data to complete your analysis, might that have had a difference on your overall analysis and recommendation?
It's kind of hard to answer that question because it's hypothetical, but I would say that I don't think so, only because more so than the data, I've been relying on the advice of Dr. Hinshaw and Dr. Sikora in terms of their recommendations and how they're much better at interpreting the medical data than I am. So I have been very much relying on, like I said on Wednesday, the health authorities and the doctors that have the word authority behind them. And I think that's, from my perspective as a public servant.
Thank you. I only have 8 seconds left. I'm also going to ask, have you taken into account any independent medical advice? That not under the employment of the government of Alberta?
Not in the last 36 hours. I have from time to time consulted other doctors, but not in this 36-hour period, no.
Okay. Thank you very much.
Thank you, Councillor Wright. Councillor Jans?
Thank you. I'm not confident in the recommendation ahead of us, and I'm interested in seeing the bylaw options that have been provided. I'm not sure what process is here, but whether it's necessary to move and second one of those options or what. Mr. Mayor?
Well, we have a motion on the floor. I think we would have to vote on this motion. And
if the motion passes, it's carried. If the motion is not passed, then we look at the two bylaw options the administration created?
That's right. That's my understanding, that if we, the motion passes, then no further action. If a motion is defeated, then we can look at the.
Okay, and may I speak to it at this time?
You can, absolutely. Yeah.
Sure. Yeah, as I said, I'm not confident in the public health measures that are being taken to protect Edmontonians. I think all of us can plainly see that this is about Kenny appeasing a piece of his base and the rural caucus in advance of a leadership vote. This is about politics, not public health. The Coots Crossing and the terrorist truckers that have come to Ottawa and occupied our capital and are inflicting all kinds of harms to Edmontonians and others, to just continue to capitulate to them is just wrong, and people will die. We know that the REP works. We know that it worked. We know that education is not the answer. Incentives and nudge theory are the answer. I saw a number of emails from folks saying now that the REP was lifted, they went swimming and for the first time in 2 years because they refused to get a vaccine. They are not going to change their views without incentive. And I think we are abdicating our responsibility to protect Edmontonians, including those of us who have done the right thing, who got the vaccine, who stayed home, who took the sick days, who did whatever we had to do to protect our families and our loved ones and each other. We followed the rules and we banged our pots for the healthcare workers who have been working tirelessly. And now a group of foreign funded, not even truckers, are occupying our provincial and federal capitals, and we're capitulating now, and we're changing orders. I see no harm in waiting another month. We're kidding ourselves if it's going to be any different for the frontline worker who is asking about an REP or asking the patron to put on a mask or asking the patron to stop yelling racist remarks. When there are jerks who are showing antisocial tendencies in our midst, the way we deal with them is not changing the rules to accommodate them. So I'm not happy here. I think we need more vaccination. We need to do everything we can to incentivize compliance, such as a third shot REP. And I think here in the city, we've seen that under 5-year-olds cannot get vaccinated. The lagging vaccination rate between 5 and 11-year-olds who are in school, which are a petri dish of highly transmissible COVID opportunity. We've seen this time and time again. We're banging our head again. It's the first wave, it's the second wave, it's the third wave, and we're kidding ourselves if anything would be different. So I see no harm in waiting another month. We already have the app, we already have the content, we already know what we need to do. And I think we need to put public health first. Yes, there are costs, but there are costs to sick days. There are costs to how many of our staff will have to leave work or will die. There are costs to our society. There are costs to our healthcare system. Every single day, a person is in the emergency room on a ventilator. That is an enormous cost that far exceeds this. So like others have said, I resent the position that we've been put in by the provincial government, but I refuse to capitulate and carry water for them.
Thank you, Councillor Jans. I don't think that is an accurate characterization of what we are doing here, right? We're trying to make a decision based on the information that is available to us, and I don't think it is fair to this council to us to lump together in a bigger we on the decision that province has made. I don't think that was your intent, but that's how it came across.
And Mr. Mayor, can I just give some advice on procedure just to clarify? So we have a motion on the floor. If council is interested in looking at the bylaws, my understanding is you have to amend the agenda to include the bylaws in for discussion. So that would be after this motion is dealt with.
After this motion is, okay, got it. Thank you so much. Councillor Rice.
I have one more question regarding the mask. I do believe either in the past 30 hours, and then based on the hundreds of emails I received, and also many people I spoke to over the phone, and then they are care about how our city moving forward regarding REP, and also they care about how this mask bylaw will impact them. So my question is, because right now our city's bylaw, I do understand we have 2 triggers in place. For that alignment piece, there is difference between our mask bylaw and provincial mask bylaw, effective February 14th. And because for children, age is different, and because this difference, I would like to understand more about how this could impact our people and in our city, and specifically this inconsistent and between the ages. And can I have more information, or you can provide more explanation on this?
Yeah, I'm not sure I can, Councillor. I mean, the inconsistency essentially will be only in areas that we don't have authority over. So it's daycares, schools, universities. So that is where the inconsistency will be. And I think it's going to be a few days before we know exactly where all the inconsistencies are, because not everybody, for example, the post-secondaries have not made all their decisions yet. So I think we can get back to you on that, but it'll probably be a week or so before we can show you where all the inconsistencies are. And then as to what the impact of those inconsistencies are, that might be harder, but we can try.
Okay, that's my question. Thank you.
Thank you, Councillor Rice. Councillor Principe?
Thank you, Mr. Mayor. I would just like to speak to this. I will not be supporting a city REP, so I will vote in favor of receiving this report for information. As Councillor Rice and Councillor Hamilton both said, I also have heard from a lot of people concerned with the city considering implementing a restrictions exemption program, and also people that were vaccinated and supported the program in the past, but they are no longer comfortable with supporting this, the REP. Now, this alone has not made me come to this decision. We do have the expertise of Dr. Sikora, who has said that the provincial easing measures are reasonable, and I am confident that he is giving us sound advice. Thank you.
Thank you, Councillor Principe. And we have Councillor Salvador next.
Thank you, Mayor Sohi. And yeah, I just felt the need to speak to this as well. And first, of course, want to thank administration for the advice that you provided, and the information you've given around what our powers may or may not be, and how some of those perceived actions could be taken by Edmontonians. I am, to be frank, quite frustrated. I think there has been a lack of transparency, lack of data, lack of consultation from the provincial government. And in the absence of that kind of information, we're left to make inferences. And I do feel like that places us in a rather vulnerable position. Our wastewater data does continue to be at levels that are exceeding those of other waves during the pandemic. We continue to have very low proportions of vaccinated children under 12 and under 5, which is very concerning to me. And I know that many Edmontonians really appreciated and quite frankly relied on the REP program, and that it was an important part of incentivizing vaccination. So, booster uptake is still relatively low, and evidence suggests that third doses do provide greater protection. So those are all significant pieces of information that suggest to me that the removal of REP may be premature. And I do firmly believe that we should be exercising the precautionary principle here. I do feel that at this stage, the removal could have significant consequences, but I recognize that we as a city might not be able to implement a program that will adequately protect Edmontonians. We do not have the same force of law as a provincial government. But I do, again, worry that there could be serious consequences because of the action of the provincial government, both on our health and on our economy, as residents may choose not to patronize businesses that they perceive as unsafe. So I've certainly heard from a significant number of residents who do feel that that's their decision point. Again, they've relied on the REP for a while now and want to know that that surety is there. So absolutely, I understand we're being asked to make a decision under very challenging circumstances, and that all of us around this table are trying to act in the best interest of Edmontonians to keep our communities safe and healthy. Absolutely. But for me, I can't vote to receive this for information. I do feel that I would be interested in seeing what bylaw options are in front of us. But if we don't proceed with the bylaw, I would absolutely hope that we're doing everything we can to support businesses who may choose to implement their own REP, including sharing of resources and whatever else is within our power to assist them in this. So thank you very much. I will yield the rest of my time.
Thank you, Councillor Salvador. Councillor Rutherford.
Yes, thank you, Mr. Mayor. I'd just like to speak to this as well. That's okay?
Yeah, go ahead. Yeah.
So I, like many, have felt a lot of emotions this week. So first of all, fatigue. I'm tired. We're all tired. All of us would like nothing more than this to be an endemic. But the harsh reality is that COVID-19 is not the regular flu. People are still dying, and there are still so many unknown impacts of long-term COVID. I'm feeling sad that we're hearing stories of how this pandemic has affected so many people, including those that have lost loved ones, people that are immune compromised or have other vulnerabilities, and those that are stressed for their loved ones' welfares, as well as those that have felt disconnected. And most importantly, I really want to highlight how hard I know our frontline workers across sectors have worked. I'm feeling angry at the provincial government for their complete lack of warning and collaboration with municipalities, and frankly, their repeated behavior of moving too fast to ease all restrictions. And lastly, I'm feeling frustration with having to try within this role to consider public health in the gap of a province that won't do so. Municipalities absolutely have a role in public health, but like many other issues we are facing as a society, cannot go it alone and be effective. As I make my decision today, these are the factors that have led me to my ultimate position to accept this report for information. First of all, again, I want to stress that health measures must be handled at the provincial level to support consistency from one jurisdiction to another to be effective. The inconsistency in the region and province weakens many of the public health benefits that we would see from a REP program. Additionally, if we have a bylaw, we must enforce it, and the resources and tools at the municipal level are limited in this regard, and I cannot see consistent application of the bylaw throughout the city. I also heard that by implementing a municipal program, we are creating an uneven and inequitable playing field for our local businesses in the capital region. Many of the consequences of this are unknown in how folks would react, but I've heard clearly that many local businesses can't take another hit. And lastly, we are not playing with the same playbook as the province, and so cannot make the decision with all the information to determine if we would be acting for that good. We have asked for this information, and I do hope we receive it. With all that being said, the same arguments cannot be said for the mask bylaw. I would urge all my fellow council members to uphold our mask bylaw and provide proven public health that has shown proven public health benefits in a way that is measured and protects vulnerable residents. Thank you.
Thank you, Councillor Rutherford. Councillor Wright. Did you have a second round, Councillor Wright?
No, I did have a second round, but I do just want to speak to it. Is that?
Yeah, I'll go to Councillor Stevenson next if she has.
Thank you.
Councillor Stevenson, you had a second round as well, right?
Yes, I did. So fine for Councillor Wright to go first.
Yeah, and Councillor, so everyone is here to speak, right? And so we don't need a third round for speaking, okay? And Councillor Rice, you have questions or just to speak?
Speak.
Okay, good. Then I'll go to Councillor Wright. Go ahead, Councillor Wright.
Okay, thank you, Mayor Sohi. So I think the decision put before us here today is, quite frankly, it's been a gut-wrenching one. I too am tired, not just from having to come to this decision and connecting with residents, but tired of the past 2 years. But I'm wondering if at this time, if we're doing a disservice to Edmontonians in bowing to the loudest voice, and I don't believe that we should be making our decision based on politics. I think we need to keep in top of mind the safety, the health, and the welfare of all Edmontonians. And so I do acknowledge those that are in opposition to the vaccine passport, that we on council don't have the medical expertise to make a fully informed decision. But then on the other hand, our provincial counterparts don't have that medical expertise either, but they do have access to that data that they're unwilling to share with us. So I guess what I have to do is weigh the options based on the feedback that I've gotten from Spomatapi residents and from all Edmontonians. And like everyone, I think I've heard contradicting rationale from business owners and specifically those in the hospitality industry. I think Katie was had asked to speak to council on behalf of the Edmonton Independent Hospitality community, who in a statement to us wholeheartedly supports continuing on with the REP. And I know that is in contradiction to some of the business associations. So again, it's, we're having to weigh this contradicting feedback. But if a bylaw to implement the city's vaccination passport doesn't proceed, then I would also encourage Edmontonians and people in surrounding communities to seek out and support these businesses as sort of a safe haven from what they've been used to since the REP has been in existence. And I know our healthcare workers are exhausted, and that's what I heard, 5 or 6 months ago as well, when out on their doorsteps and urging and encouraging me and making sure as part of my priorities that we would continue to support them. And so I can only imagine what state they are in now. And I did speak to a nurse last night whose colleagues are quite frankly exhausted. I've gotten information from long-term care facilities that they're holding the line on their visitation policy because of, and I quote, the continuing community spread. And I know that there's mental health concerns have also been raised by Edmontonians, but we need to consider both sides of that. And there are those that felt able, when the REP was instituted, they felt able to come out and safely come back out into community, to meet at the Meadows Rec Center and join their friends on regular basis, because they were confident that people coming into that facility were less likely to transmit the disease. And they felt also comfortable that they weren't going to possibly transmit the disease if they unknowingly had it to others. Less chance of it with the vaccinations. So I did come into this meeting today of the mindset that I would accept administration's recommendations to not go forward with any such bylaw to have a vaccine passport. But I don't think that they've been given the full amount of information in order to complete an analysis. And for that reason, I cannot support receiving their report for information and their subsequent recommendation. Thank you.
Thank you, Councillor Wright. Councillor Stevenson?
Yes, thank you, Mr. Mayor. As many of my colleagues have alluded to, it's been very difficult and very frustrating to be making decisions in the past few days. And similar to Councillor Wright, I also came into this conversation prepared to accept for information, recognizing some of the real and genuine challenges that do exist in implementing this. But through the conversation, what's really struck me is that we have spent this time talking about what we won't be doing and not enough about what we will be doing, because there is absolutely a large cohort of Edmontonians who are looking to us for leadership, looking to the city to do everything that we can to keep them safe. And I don't know that we've explored that adequately. I don't know that we have measures in place, we have processes in place, but I'm not seeing that vision and that leadership that I am hoping to see from the organization that has been present throughout so much of the pandemic, and which I have heard so much about in terms of how highly appreciated that's been. It's been very challenging to talk about a bylaw that we haven't been able to review or understand the wording and implications of fully. And it's been difficult that other alternatives haven't been brought forward. I think the lessons of the pandemic up until now have shown us that moving too quickly often sets us further back in the long run. And it's that uncertainty that I worry about contributing to in terms of where we will be a month from now, 6 weeks from now. I'm also tired. I'm also at a point in the pandemic where, yeah, it's challenging to accept the ongoing restrictions. None of us want to be in a pandemic right now, but it's what we choose to do to take care of each other moving through it. So I will not be supporting, I will not be accepting the report for information, and I am hopeful and have been pleased to hear about the ongoing communication efforts that the city can make, and I think we can all take some time to think of what are those other measures, what are the creative solutions that we can bring to our community that's looking to us to keep them safe. Thank you.
Thank you, Councillor Stevenson. Councillor Rice.
Thank you, Ms. Mayor. I know it's a very challenging and a difficult time and a decision for us to make. So I come in today and with only 4 hours sleep last night, because I have to respond to so many emails and talk to so many my constituents over the phone. I think, yes, I believe everybody in this city council care about our Edmontonians. Our public safety is important for everybody, and we care for each other and we look after each other. And however, I believe and the city should stay and with jurisdictionary boundaries. Province has access to the best expert advice and issues related to the health that are the purview of the province. And also, and from our Dr. Sekera, I heard very, very clearly, he stated he supports removing the restriction exemption program. I believe we should follow the advice our professional medical advisor. I'm not a doctor, and to my knowledge, none of you in this council have medical degree either. I do not believe we should make medical decisions related to the health of our constituents that go against what our medical advisor is telling us. Dr. Sekera also said he's not aware of any mental health impacts studies related to COVID restrictions that have been completed. That said, we have all heard the mental health concerns voiced by Edmontonians over the past 2 years. I believe we need to take this issue seriously and give people relief from those restrictions, especially when the health data available to us is showing that America, sorry, forgive my English as second language, wave is coming to an end. And we talk about, yes, we listen to the people and we want to support people. Do we ask what people want? Do we ask this question? What is our Edmontonians want? By look at all the email in the past 30 hours. Look at your email inboxes. I responded to each of them. And they responded me back. I spoke to many, many people over the phone in the past 30 hours. If you are talking about to support our people, and why not asking what the people want? So from mental health, from jurisdictional boundaries, from what our Edmontonians want, and specifically for the business, what the business wants. Did you heard how many businesses said? And because of this, they're planning to move out of Edmonton. Do you want to see our Edmonton economic going down? I don't believe with any business as a fundamental support to our economic development, we can have that sufficient financial resources to support our social commitments, to support our vulnerable population. We need to support them. And then the principle I over and over told myself, and then we need to have better financial situation to support our Edmontonians. We cannot talk about this without refer back how we can get our good or better financial situation. And that there's so many reasons for us to moving forward with so many Edmontonians want us to move forward. This is not about leadership. It's about what's the best for our majority, our Edmontonians. With this say, I'm going to support this report be received for the information. And thank you very much.
Thank you, Councillor Rice. And I will go next to, actually before I do go to Councillor Tang, if you indulge me for a minute. Our city manager has a quick update to give to us.
Thank you, Your Worship. Yeah, I just think it's relevant to some of what I've heard, which is in terms of what else we can do. And so I just wanted to inform Council that earlier today we applied for, in terms of dealing with some of what our residents are dealing with protesters, we applied for an injunction. And I've just been advised that the judge has granted our injunction, and the city has granted an interim injunction pursuant to Section 554 of the Municipal Government Act, RSA 2000, CM 26, prohibiting the respondents, i.e. protesters, from the frequent or sustained sounding of motor vehicle horns, truck air horns, equipment horns, megaphones, and other similar noise-making devices within the boundaries of the city, contrary to the Community Standards Bylaw 14600. The city solicitor will get a memo to council as soon as possible with all of that detail, and we've got a comms plan that will go out to explain that in short order. Thank you.
Thank you. That's another example. What are we doing to make life easier for Edmontonians during these difficult times? And I'll go to Councillor Tang next.
Thank you so much, Mr. Mayor, and that's excellent to hear, and good to see that we're using the tools that we do have to fight back. I think one thing I'll definitely agree with in Councillor Rice's point is certainly this idea of talking to our constituents. And in fact, when this came up on Wednesday, I thought it was an excellent idea. And I did reach out to those who are, living in Ward Gare-Hio for their stories and lived experiences, because I felt that was really missing in all the unsolicited emails and phone calls of folks yelling at us. That diverse perspective was missing. And so in 24 hours, Edmontonians and Ward Gare-Hio residents responded in hundreds via email, Google Forms, social media, and phone calls. And I was heartened to see people sharing compassionate, level-headed, and thoughtful responses and reflections, whether they were for or against greater COVID-19 protections by government. And stories on both sides are heartbreaking. There's a lot of concern about, our most vulnerable populations, those who are immunocompromised or those with families who are immunocompromised. There's a lot of concerns about children, how their mental well-being is suffering because they choose to wear a mask or be vaccinated, or the other way around. People are being harassed for doing one or the other, frontline servers who are feeling incredibly vulnerable, knowing that they will be forced to serve the unmasked and unvaccinated. And at the same time, businesses are saying that they can't take any more up and downs. They're at the end of their ropes. Medical professionals also spoke up, reflecting much of what I heard in the conversation with Dr. Sikora in council the other day. Parents talking about, again, children's mental health, and also concerns for those who care and support their growth. And I don't think we should write anyone off. And I think each story that I read word for word is unique and complex. But at the end of the day, people are frustrated, tired, weary, and scared. We're scared of not being able to live freely in the public sphere that is safe because of all the protections in place. We're scared of constantly being judged no matter what we do. And we're angry. We're angry at the province. We're angry at the state that we're in. And, whether we're for or against these COVID measures, we're just weary and tired of the politicization of these decisions and the divisions that they're creating. And yes, I absolutely agree. Many of these decisions are absolutely political. And once again, through this pandemic, it is left to cities to deal with the aftermath. And I guess, one thing that's been guiding my thought process when it comes to this decision is, what do we need to do as a city when it comes to dealing with the measures? I want to see us providing reassurances based on expert recommendations instead of adding burdens to businesses and frontline workers. I want to see measures that diffuse and depolarize rather than continuing to divide. And particularly, this is true when we think about the values that we had discussed the other day when it comes to clarity, consistency, and fairness, which have been well articulated by many of my colleagues. So I'm supporting the motion on the floor today and accept the recommendations from administration. But that said, many people have also said that the municipality should stay in their lane, that we shouldn't interfere with public health or health matters, but I would really disagree with that. Good governance that includes safety and health of residents is actually enshrined in the roles of cities for thousands of years. I mean, yes, there's a lot we can't not do, but there's also a lot we can do. And I think about the significant contribution to better, health of the entire populations in the last several hundred years that has been done by cities. Things like sanitation, clean water and air, smoking cessation regulations, limiting sugar and drinks in recreation centers to reduce childhood obesity, speed limits that actually scientifically demonstrate a reduction in injury and promotes road safety. And these are all municipal interventions. And I think, like I mentioned earlier, much of the COVID measures today have been focused on behavior change, which is extremely hard without, structural and environmental changes to accompany that. And that's why this is something I'm particularly interested in and would like to explore more. And I'll speak to that when the time is appropriate. Thank you, Mr. Mayor.
Thank you, Councillor Tang. So we have few other people to speak. I would suggest that we continue during the break once we have done with when we have voted on this item. After that, we can take a break. Is that okay with everyone? If you could nod your heads. Okay, good. All right, thank you so much. And I'll go to Councillor Cartmell next.
Thank you, Mayor Sohi. And, again, particular thanks to administration and particular thanks to Councillor Tang for those very articulate comments about all of the other things that cities do that relate to safety. I'm not going to try to repeat because I think she nailed them entirely and completely. Some have spoken to fatigue. I'm remembering a time roughly 2 years ago, not quite 2 years ago, when the provincial government made it clear to council at that time that they very much wanted to hand this issue to the local councils, particularly the big city councils. They wanted us to act because we had that local perspective. They did not want to act of their own accord. And not knowing the implications in the moment, we accepted that torch and carried it. And, I kind of regret that, to be perfectly frank, because that started this hot potato game that has gone back and forth for 2 years. And that is, I think, created some misplaced expectation that City Council has all the tools to compensate for what the province may or may not do. And this is what we're hearing today, that while it may have been desirable for a passport program to remain in place for a few more weeks or a little longer than that, we don't have the capacity to stand that up on our own. We don't have the weight of a provincial restriction or health order. We don't have, at this point in time, quite frankly, the take up from our constituents, you know, in a solid way. It's split roughly 50-50. This is what engagement from my constituents have shown as well. And so we can't rely on everyone's good graces to obey the law simply by writing a law. And we've seen most recently that there's a lot of people out there right now that, for whatever reason, have lost their capacity to act respectfully. And so for us to put in a bylaw that is virtually unenforceable, to put frontline persons in that place of trying to enforce something in a continually and ever more heightened environment of potential violence, potential confrontation, potential bad outcomes, is we have to weigh that. We have to weigh the risk of creating those really bad situations against the risk of the value, the ongoing value of a passport program. With Delta, there was strong correlation that those that were not vaccinated were also a contagious threat to those that were. But with Omicron, we're seeing that that is not as much the case. The correlation is not as strong. That we need to shift our focus from those who have been vaccinated to those who are symptomatic or asymptomatic and contagious to those around them. We need to move our focus from monitoring who is vaccinated or unvaccinated, which really does not necessarily correlate to transmission or spread, and shift our focus to limiting transfer. And how can we do that? By maintaining a mask bylaw, at least until we get a more normalized hospitalization numbers. We can do that by asking those, reminding those that are symptomatic to stay home and isolate. And reminding those that aren't showing symptoms that they may still be infected and they may still be contagious. And that is the value of a mask program, is to stop that spread. But standing up bylaws in either one of those matters simply just puts a lot of people in a very bad situation to no particular effect. I do not think there's any further value in a vaccination program to drive more people to get vaccinated. We are at peak cooperation here. And I understand that there's some question around the youngest of children about how much uptake there is. But I'm not sure that a passport program is actually going to be the thing that drives us to get more vaccinations. I think there's perhaps some bad information, perhaps some confusion, perhaps some real trepidation amongst parents about that. And I see that as a divided cohort as well. And I don't think the answer is further bylaws. So for that reason, I'm going to support receipt of information on this matter. Thank you.
Thank you, Councillor Cartmel. Councillor Knack.
Thank you, Mr. Mayor. While I will be supporting this motion to receive for information, I want to share some thoughts on what I've heard. So on November 3rd, 2020, we experienced about 15 deaths from COVID-19. And by that point in time, we had been tracking this data for about 6 months. And I think it was the first time we surpassed double digits in the number of Albertans who lost their lives. That was a hard number to accept, and I know the vast majority of Edmontonians were quite concerned about the well-being of our community. Just yesterday, there were 22 COVID deaths, and I think it's safe to say that the majority of us didn't actually have the same reaction as we did a year and a half ago. Even though we become more desensitized to the total number reported every day, we cannot forget that we have lost thousands of people in this province over the last 2 years. And contrary to some of the emails and messages over the last 2 years, but especially the last 2 days, COVID and the flu are clearly not the same thing, and this pandemic is not a hoax. Any suggestion otherwise is not based on facts. I believe the province is removing public health measures too quickly yet again. I wish that wasn't the case, and I hope that at this time, those of us who think it's premature will be proven wrong. But my lack of confidence really stems from two key points. The first is not having access to Dr. Hinshaw's recommendations and the data used by the provincial government to inform their recent decision. That was even more evident during yesterday's public health update. And the other point is with conversations from nurses and doctors working on the front line in our hospitals. The vast majority of those that I've spoken with still have concerns about the pace of change and have suggested we exercise caution as we move forward. We should have a third shot REP province-wide. But I don't believe we have an easy way to administer a municipal REP and appreciate that even if we could create one, the lack of cooperation from the provincial government in relation to things like access to data adds to that challenge. The not having consistency across the region would also make things very difficult for our small businesses who have been struggling. I heard that even from the Stony Plain Road BIA yesterday, which includes many people who believe the province is moving far too quick. I also want to share a bit of what I heard from residents, and I don't want to spend much time on the positions of those who have more extreme views because frankly, I think they've been given a disproportionate amount of attention during this pandemic, but I want to acknowledge a few points. The public health measures that we've had in place are not tyranny, they're not genocide, they're not anything remotely close to that. Thousands of people, as mentioned earlier, have died in Alberta, and almost 5.8 million people have lost loved ones in the last 2 years. That unimaginable loss of life happened even with the vast majority of countries taking significant actions to help reduce the spread of the virus. We know that tens of thousands of Albertans have had surgeries postponed and canceled due to the impact to our healthcare system. That includes people who are looking to get exploratory surgeries for cancer treatments. That includes seniors who are waiting for hip replacements to improve their quality of life. And I realize saying this isn't going to convince those who share those extreme views, but we should acknowledge that reality because that is the reality. But for the rest of my time, I just want to speak to the majority of people who have taken the time, who are, I think, far more reasonable in their approach. I heard from a lot of people in the last 48 hours, people who are supportive, who have been supportive of public health measures throughout this entire time, who are concerned about a municipal REP for some of the reasons we talked about earlier. They're also concerned about that notion of division and the benefits of not having a program that's consistent. I would say I actually don't believe that we are nearly as divided as things are made out to be. I don't believe that for one moment. And I also heard from people who believe the provincial government's acting far too quickly, similar to me, and are worried about what that means for their loved ones and their family. And one of the biggest concerns I have with moving forward into living with this virus, as the Premier has talked about, is that we have no idea what that actually looks like yet. Seniors are dying at a much higher rate than with the standard flu. Is that increase in deaths going to become the new reality? Are there steps that we could take as a society to prevent or reduce that in what might be a new normal? Would those steps create mental health challenges or economic challenges? We don't actually have the answers to any of those questions, and that's not right. The provincial government has clearly failed us, and we all deserve better than that. And unfortunately, even though they failed, I don't see how we can create our own. So I'll support this for information, but wanted to thank you for your time, Mr. Mayor. Thanks, Mr. Mayor.
Thank you, Councillor Knack. And before I go to Councillor Paquette to close, Councillor Salvador, can you take the chair, please?
Yes, I have the chair.
Thank you. I know that there are many Edmontonians who are disappointed by the way our provincial government lifted COVID restrictions too fast, too quick, instead of taking a gradual approach. As your mayor, I am disappointed too. Our provincial government did not consult with anyone, with your local municipality, with our businesses, our school boards, before making a decision that impacts us all. These decisions forced people to scramble overnight to figure out how they should run their businesses the very next day. That was unfair and unacceptable. We know that the restriction exemption program worked. It encouraged people to get vaccinated. It gave consumers the confidence to support local businesses while feeling safe. And sadly, their consumer confidence is now eroded. It also gave a sense of safety to the people working on the front lines for the past 2 years. It reduced their exposure to COVID, which helped to keep them safe and their families safe. Now, with these restrictions lifted, these workers will be exposed to unvaccinated veterans. Our city council heard loud and clear from Edmontonians that they wanted us to explore options to bring a municipal restriction exemption program. And today, we looked at those options. But unfortunately, a local Edmonton alone REP program just won't work as much as we wish it would. Having a municipal restriction exemption program would create more uncertainty for business at a time when they're looking for certainty. Municipalities don't have the tools and resources to enforce a program like this, and the burden will fall on frontline vulnerable workers who have already gone through enough. And we cannot, in good conscience, put them in harm's way with so much tension and polarization on this issue. I know that some of you will be disappointed. I hear you. But leadership is also about being honest to you. I, in good conscience, don't want to give you false hope that a municipal REP program will protect you, because a municipal version of this program will not work in the same way the provincial program worked. The fact is, the province did not have to remove restrictions with essentially no notice and no consultation. On collaboration, I have been working hard to build a collaborative relationship with this provincial government. But Edmontonians must be included in the conversation that affect our people's well-being. And so I urge our provincial government to work with us to ensure that businesses, parents, kids, health-compromised folks, and our elderly can navigate this pandemic with safety and certainty. Finally, a message to everyone listening. You have done your part. You have done the right thing. You stayed home when you were sick. You have worn a mask on the grocery stores to pick up your kids. You have gotten vaccinated, and many of you have had your booster. I also want to, you've been doing that for 700 days now. We're all tired. We want this COVID to be behind us, but it's not going to be behind us by having a wishful thinking the way this provincial government is thinking. So I want to start all Edmontonians for doing their part, particularly those who have been on the front lines during this pandemic. Our nurses, doctors, teachers, store clerks, transit, taxi drivers, truck drivers, and people who work in the hospitality industry. You kept us safe, and you kept our economy and city moving. So thank you for that. And we will do what we can that is in our capacity to keep you safe. We will continue to have the mask bylaw. We will continue to require masking on transit. We will continue to explore legal options as we have done today to make sure your well-being is protected. But this is something the REP program is not going to work. And I'll take the chair back.
Yep, chair is yours, Mr. Mayor.
And I'll go to Councillor Paquette.
Thank you, Mr. Mayor, and thank you to all my colleagues for your thoughtful words. This is a difficult situation that we have been put into. And regardless of the outcome of the vote, for some it will be hard news, and for others a sense of relief. Now, with the ending of an REP program and the potential of not having a municipal REP program, that relief, and we have to acknowledge this, is in the form of easing of fear from inappropriate retaliation from a small minority who would choose to offer abuse to the folks in their community just trying to follow the rules that are intended to limit the impact of COVID spread. This is unacceptable. It's an unacceptable aspect of this conversation. In no way should the decision today, no matter what it is, be seen as awarding bad behavior, but instead a frank look at the reality of this situation. Let me just say, when aggressive behavior is normalized, we have a very serious problem on our hands. And when leadership normalizes aggressive behavior from one citizen to another, we have a serious problem on our hands that all people in Edmonton and across this nation should take serious note of. Now, without provincial participation, a local REP is in essence not feasible. We have no support, no data, despite asking for it. And if implemented, I am absolutely confident the province will step in to change legislation, rendering our efforts legally unsustainable. Now, this issue has been polarized. A health discussion has been successfully subverted into a politically partisan quagmire that is also deeply concerning. And the idea that if the city were to implement an REP, that people would move or we would lose people from Edmonton. Where are they going to move to? Every other province is more highly regulated than Alberta. And I just want to say, we should mention this. Dr. Sikor is not our advisor. He's an extension of AHS with the attendant messaging. Let's just keep that clear. And as councillors get used to special interest emails, campaigns flooding their inbox, they may also learn to follow up by determining how many of them actually live in their ward or indeed in Edmonton. And that may be an eye-opener for you. Now, I absolutely reject the sociopathic indifference that some promote, that because people die every day of other ailments and conditions, that we should remove all public health measures. We should obviously care about all of these things and mitigate harm anywhere we can. I'd like to say that after this vote, we put the matter to rest, but my concern is that the potential for a reintroduction of restrictions on a provincial level, because they were ended, as we've seen historically over and over again, just a little too soon, may be a reality we face in the next 3 to 4 months. No one wants restrictions. No one. But I think everyone wants to get off of the COVID policy roller coaster. To have a steady hand at the tiller of leadership. I hope to never have to address this again, but I'm assuming that we will. In the meantime, we have our own mask mandate in place. We will have our own policies in place at our facilities. And while I wish that we could help businesses navigate through this, the fact is, because of the bad behavior of others, we simply do not have the capacity, and we certainly do not have the provincial support. And so I am reluctantly voting in favor of this receipt of information. But frankly, this is the position we are in. Thank you, Mr. Mayor.
Thank you, Councillor Paquette. Please vote.
So Councillor Wright, we're missing your vote, and Mayor.
I can't see my vote, but I'm in favor of receiving for information.
We have the votes. Please display the votes.
Display the votes, please. That is carried. Okay, so what is next, Madam Clerk?
I think you said you were going to take your recess that you delayed, unless, or are we working through the recess? It was scheduled for 3:30.
Okay, well, so when we come back, what would be on the agenda?
This is your main agenda item. If there's any other subsequent motions or any other points.
Yes, we do have
Yeah.
subsequent motions, so
Yeah.
we'll take a break now.
Yeah.
For 15 minutes.
Thank you.
Yeah. We are in the recess now for 15 minutes. Okay. Hi, everyone. I would like to call this meeting back to order. I'll do a quick roll call. Councillor Wright. Councillor Knack.
Good afternoon.
Councillor Prinspe.
Present.
Councillor Stevenson.
Good afternoon.
Councillor Paquette.
Good afternoon.
Councillor Tang.
Hello.
Councillor Hamilton.
Hello.
Councillor Rutherford.
Hello.
Councillor Salvador.
Hello.
Councillor Cartmel.
Good afternoon.
Councillor Rice.
Good afternoon.
Councillor Jans.
Hello.
And Councillor Wright.
Yes, I'm back. Thank you.
Good. All right. So, Madam Clerk, I have a subsequent motion, so I have to cede chair to Deputy Mayor, right?
That's correct.
So, Councillor Salvador, can you take the chair, please?
Yes, I have the chair.
So, you have the copy of my subsequent motion, right?
Yes,
Madam
I
Clerk?
believe we do.
If you don't mind. Basically, what I'm asking is that it's basically on the consultation process in this where we were not consulted, so that I'm saying that the mayor, on behalf of Edmonton City Council, requests that the province of Alberta develop a formal bilateral consultation and engagement process with the City of Edmonton to discuss issues of mutual interest, and that the province of Alberta consult and seek input from the City of Edmonton before lifting further COVID-19 protocols.
Thank you, Mr. Mayor, for putting this on the table and introducing. I guess we can go to any questions.
Second. No one seconded
Oh, apologies. Thank you, Councillor Hamilton. So moved by Mayor Sohi, seconded by Councillor Hamilton. Yeah, and any questions for the mover? Just give everyone a second to hop on if there are any. Not seeing anyone on the board. Mayor Sohi, would you like to close before we go to a vote?
Yeah, very, very quickly. I know we have limited time, and there are other subsequent motions as well, right? I think one thing that this whole discussion around COVID and the decision-making process from the province really revealed the lack of having a process in place that triggers a consultation and engagement process with the city from the province. And had we had a process in place, then province would have been obligated to inform us and engage with us and let us know in far advance what actions they were going to take, and so we would not have been taken by surprise as we have in this case. And having a process like this, not only on this matter, but I think as we try to strengthen our working relationship with the provincial government, we need to have a structure in place. And I think this motion, if they are agree to have conversation with us, will allow us to initiate those conversations with the province on having that kind of bilateral relationship that exists between other orders of government, but does not exist between a provincial government and in our city.
Thank you, Mayor Sohi. And I do see Councillor Principe on the board, but Madam Clerk, since Mayor Sohi's already closed, we don't typically have that opportunity, correct?
Let me just double check.
Okay, I believe that's the process.
So just to clarify, if the chair or Mayor Sohi was introducing the motion, then there would be an opportunity for colleagues to ask questions.
Yeah, and Mayor Sohi has just closed, so I believe we go to a vote at this point. All right, so yeah, let's go to a vote, folks.
I'm in favor.
Yes, Madam Clerk.
Yes.
Councillor Jans?
Sorry, I'm not indicating to speak. I was trying to vote, but eScribe's stuck. So, are we still voting?
We're voting. We're waiting for your vote.
Oh, I see. I will vote yes.
We have all of the votes.
And please display the vote. That is carried. And Mayor Sohi, I will pass the chair back to you.
Thank you, Councillor Salvador, and I'll go to other council members for their subsequent motions on this. I see Councillor Tang raising her hand, but can you click on Councillor Tang? Here you go.
Okay, yeah, sorry, that wasn't quite showing up. Yes, I would like to put forward another subsequent. And as the clerk pulls out the wording, oh no, you got it. That administration explore the effectiveness, feasibility, and cost of installing HEPA air filtration systems in city-owned facilities as a preventative measure against COVID-19 and include any site-specific recommendations.
Seconded.
Thank you, Councillor Jans. And I just to introduce this a little bit, and I think this is an area I don't believe that we as a city have really quite explored in terms of the tools in our toolbox. And this is that environmental / structural change that I'm quite interested in. And this is not too dissimilar from a very recent motion passed at the school board to install air filtration system in classrooms, but I'm thinking more of city-owned facilities, including libraries, rec centers, and I would just be very interested in exploring that. I mean, I know we all heard Dr. Sikora say earlier that the research on this is, variable. It really depends. And certainly according to, the Environmental Protection Agency, if air filtration alone might not be as effective, however, coupled with other public health measures, and especially if we intend on, depending on the will of the council, and if we intend on keeping the mask bylaw, for example, it will definitely increase its effectiveness. And I've also included this piece about site-specific recommendations, certainly depending on the age of the building, the age of sort of the state of the existing system. There's a lot to consider there, but I don't think we should rule this option out. And I think we need to do our homework and to make sure that we're actually exercising all the tools we have. And that's it. Thank you, Mr. Mayor.
Thank you, Councillor Tang. And just on the timing of a report coming back, we need.
Oh my God, I'm so sorry. So I would like this to come back for the March 14th City Council meeting, and I realize it's less than a month.
That won't be possible, Councillor Tang. We have so many other things on the agenda, and I see Mayor City Manager saying no. That so.
Yeah. So I'll just maybe lay out my rationale for that timeline, and happy to shift depending on the workload. But the thinking here is that to install any kind of this kind of system will require budget consideration. And I wanted to line it up with the spring supplemental operation budget adjustment discussions at that time. So that's that. Thank you.
So, Madam, Mr. City Clerk, Mr. Corbould.
Yeah,
actually, Mike.
Sorry, Your Worship. Yeah, we've been trying to see what we could do. So I'm just going to see if DCM.
I know Lachlan is
could
there. Yeah.
Do what he can do. I think I get the point about spring adjustment. So Adam, did you want to comment?
Yeah, my just check and see if you can hear me. Okay.
Yeah.
My recommendation, Councillor Tang, is actually that we're looking at a couple of pilots already in different facilities. And I can give you some numbers right now, and that's probably the best information that we'd be able to provide you on March 14th. So my recommendation is actually that we would bring it back as part of with the supplementary capital budget rather than a report in advance. And then you can have that discussion as part of the budget, and that would give us the time to do the work. We're currently identifying, and if Ms. Padbury's on, she can give maybe more specific dates, but for capital, I think we're looking at a June timeframe. And that would allow us to do the analysis that you've asked for in this, specifically identifying the best method to pursue this. And then it comes with it comes at the right time because then it is a budget discussion.
Sorry, just so I'm clear on the timeline then, the results and the budget you're saying will come back in June, but sort of ahead of that, you can prepare something in time for the spring SOBA discussion?
My recommendation is that we bring this report back as part of those discussions. So it would be a report that would come with the SCBA.
Okay.
And if Ms. Padbury has another suggestion, I'm certainly open to that.
No, I would just say that it would be the supplemental capital, which is scheduled usually for late May, early June, as opposed to the supplemental operating, which is done in late April.
Okay, so that would be bringing back part of supplemental capital budget, right?
Yes, and that would give us the time to do the analysis as you identified, Councillor Tang, because the comparable to the schools is quite different. Our facilities are very different in terms of configuration.
Yeah, absolutely, and I recognize that, and I just want this to be a pretty concrete discussion when it comes to budget. So I'm open to that, especially since this is a capital decision.
Okay, good. Thank you.
The only comment I would add, Your Worship, is that I hope this is not seen as an invitation to get 20 or 30 more of these types of motions to bring back with the spring supplemental budget, because that would be something I don't think we could properly do.
Yeah, that's a very good caution. Thank you for that. Thank you. Okay, Councillor Rice.
I do have a few questions. The first question is to Mover, Councillor Tam, and then would you mind to give a little bit more information regarding the effectiveness, and also and it's my understanding, and then this type of capital project actually is not effective, and then also is very expensive. Do you have any sense about which angle you would like to look at effectiveness, and then what the cost could be, and what is this the core services related priority, and for us to make that budget adjustment in the spring?
That's effectively what this motion does, is to explore the answers to those questions. And I would disagree in terms of a very solid conclusion that this is not effective, because I think we also heard from Dr. Skora earlier that it is variable, and I think that is something that we need to examine through this work.
Okay, so you would like the cost and benefits analysis to be included in the report?
Yep, that's what what I mean when I say explore the effectiveness, feasibility, and cost.
Okay, so another question is a follow-up, and in Flex, we just passed reports to receive the information, and then from future and looking forward perspective, and how this could be used to related to the COVID-19. Yeah, I understand, and we talked about the COVID-19 may last longer than we expected, and so I just want to figure out that connection, how we want to use this air filtration systems as a preventative measure against the COVID-19. So how that connection can you bring a little bit more?
As we've heard earlier in that discussion, there is a lot of benefits in terms of, just constant cycling and making sure that we have fresh air inside. And that's, there's a lot of rationale for that. And again, this is exploration. And I think we need to examine that. And long-term wise, I think it's probably a long-term benefit for the whole of population to have better indoor air quality in the city-owned facilities as well. And if there's pilot projects already happening to kind of explore this area, I think it's a sound direction that we could potentially be moving into. COVID or not, I think it's I think good air, clean air is an important aspect of public health.
So I understand our spring adjustment will be happening in April. If we request this, is there any, this question is more to administration, is there any overlap work and then compared to the pilot project already is going on and in place right now?
So to be clear, this would be capital, not operating. So it'd be late May, June for that kind of discussion. And in terms of other competing projects, I don't think we were anticipating any large capital adjustments. We are in the last year of a 4-year, and council approved a significant amount in the fall. The supplementary capital budget adjustment we're anticipating is to deal with any items that were flagged previously for council in terms of budget pressures. So not anticipating any significant capital adjustments other than those typical transactional adjustments or emerging items. Based on this motion, it would be bringing a report back at the same time as SVBA so that council, the supplementary capital budget adjustment, so that council could have that discussion as part of that process.
Okay. Thank you.
Thank you, Councillor Rice. Councillor Paquette.
Thank you, Mr. Mayor. So administration, whoever is best able to answer this. So I'm just thinking about timelines here. Now, granted, no one thought that we'd still be talking about COVID 2 years later, but thinking about the timelines of this, would you consider this like a COVID action or like maybe a preventative action for future unknowns?
I hope it'll be the latter, Councillor, but I think time will tell.
Yeah, okay. So, and this would be just another one of those layers in the Swiss cheese sort of approach to filtering out airborne virus. Is that right? Is that how you read it?
I don't know if that's a question to admin or the mover.
I would say, I mean, just from my perspective, yes.
Yeah. Okay. And I guess to admin, is that sort of the approach that you're taking as well?
The reason we're doing the pilots is because of assessments that have been done in what I would call high traffic locations and the ability to use quick systems to help in that regard. With this analysis, we can do, or with this motion, we can do some more detailed analysis to see what the best approach is if it makes sense. For example, in large areas, we would not be looking at sort of the school method of plugging in a portable system because it wouldn't actually provide the effective filtration for an area that is in a large space. So it would be based on the facility type, use, and cost to see what the best solution would be.
So based on the facility type, personal masking is probably still the best filtration approach. Is what I'm hearing.
Well, I think you've heard that from our medical professionals that masking is still the best approach. Yes.
Yeah. So with that in mind, I'm just wondering. It's a little tangential, but definitely related to this. With our mask bylaw, we know that we're getting, according to observations, pretty high participation. But according to emails we get and comments that we see, some people feel like that participation in masking is not enough. So as we await the report on this, can we expect to see a higher degree of enforcement on masking? Because I do believe the time for education is probably long past. I think people get it at this point. And that, I guess, that would be to Mr. Corbould.
I'm sorry, Councillor. I was distracted.
That's okay. I've got
Time
a
for
very
education.
relaxing voice.
It's more of a comment, right? Time for education is over, right? So I think perspective, right? So
sorry about that, Councillor.
Yeah. Okay. Any more questions, Councillor?
Basically, what I'm asking is, as we wait for this, because this is intended to be another filter, and we do have a mask bylaw, and we know that from Dr. Sikora that masking is probably one of the best, filtration systems we've got in large areas. Are we going to anticipate seeing more enforcement of the mask bylaw because I know that our approach is always education first, but 2 years into the pandemic, I'm pretty sure that we can move to enforcement.
Well, I would just say though that 90% compliance, 97% compliance consistently on the mask bylaw, and we continue to watch that. So it's going to be hard to go from that to 100%. Possibly we've dipped recently just because of behaviors, but we're still pretty high on compliance of the mask bylaw.
Yeah, and also not related to this motion, subsequent, Councillor Paquette.
Okay. No, I can see it. It is like there is like a connection, but I see your point. Okay, thank you, Mr. Mayor.
Thank you, Councillor Paquette. Councillor Jans.
Just a technical thing. I still support the motion, but I want to withdraw my second. I believe Councillor Rutherford was going to second.
Councillor Rutherford is okay with that too, right? So we can change that.
Sure.
Okay, good. Thank you, Councillor Rutherford. All right, so Councillor Rutherford, you're next.
Yeah, I have a question for admin first of all. What would the timeline look like if we did want this sort of as an unfunded package for the 2023 to 2026 budget cycle? When would we need kind of information on this to come back? Would that help ease the timelines a little bit? The pressures?
Well, I think certainly that would provide more time. Supplementary capital is June 2023 to 2026. Discussions are going to be in the fall. I think we can pull this together on the basis of the pilot work that's already underway.
Okay.
And again, our approach would be if this report were at the SCBA in June, it could be an incremental discussion with a sort of a more broadcast approach as part of the 23 to 26.
Okay. Okay, perfect. And then, we're talking about the masks, but I think it's really important to, we've talked also about how we're going above and beyond with certain health measures because of our OH&S requirements. And, when we're talking about city facilities, we're also talking about City of Edmonton staff and employees. So, Mr. Corwold, could you speak to that a little bit and if you would see any benefit from this from a OH&S perspective?
Yeah, I think there could be. I mean, we'll have to see the results of this, but I would also say we've done quite a few things in COVID from an employee health and safety perspective, and I think of some of the work we did on buses with the plexiglass barriers to protect our drivers and some of the enhanced cleaning we've done, and I think I see this as part of that sort of suite of potential protections that are very good for employee health and safety. Thank you.
Okay, those are all my questions. Thank you.
Thank you, Councillor Rutherford. I see no more questions on this. So, Councillor Tang, I'll go to you to close. If you want to close, otherwise we can go to vote.
Yeah, I guess just very briefly, I think, I think there just could be also long-term benefits when it comes to just better infrastructure for that OHS consideration. I think this is, anyways, in general, I like to sort of explore these structural and environmental pieces that is within city control. And yes, it's gonna cost money. If we did decide to go in that direction, and I'm not suggesting this as a standalone only for COVID kind of measures. I think in the long term it could benefit our rec center infrastructure as well, which is our core services. So I think the timing of this I think is good, and I appreciate Mr. Laughlin for mentioning sort of knowing the information earlier in May and June for that, incremental consideration. And, if this council decides that's the direction we want to go, we can have much bigger discussion about about decisions that could have bigger impact as part of the 4-year cycle. So, I appreciate you all letting me put this on the table, and I urge my colleagues to support this. Thank you.
Thank you, Councillor Tank. Please vote. My e-scribe doesn't work. I know what.
In favor, Mr. Mayor. Jans.
Thank you, Councillor Jans. Me too. I'm in favor. So e-scribe doesn't work for me. I don't know why.
I'm in favor. Councillor Wright.
We got all the votes. Please display the votes. That is carried.
Mr. Mayor, I have a point of order.
Okay, Councillor Principe, what is your point of order?
This is in regards to the previous motion that I was not allowed to speak at. My point of order is that, as from what I understand, the process is questions to the mover, and then after that, are we not granted the ability to speak to the motion?
Yeah.
It was just framed questions to the mover.
Yeah, so I'll ask Madam Clerk to comment on that. By my understanding, what happened was that I moved the motion and then I introduced the motion. Then there were, I think, no questions. Then I closed on the motion.
Right, so it was right after questions to the mover. There were no questions to the mover, so I clicked on to speak to the motion. But you spoke before I could. And I'll just say that the reason I want to speak to the motion is because I saw some of my colleagues shaking their heads when they saw my vote.
Oh.
And so I would like to have a reason as to why I voted that way. An explanation.
Just hold on, Councillor Principe. Let me ask Madam Clerk to what the process be, because we want to make sure we follow the proper process for you to allow you to do so. What is the process?
I'm going to just ask that the Madam Clerk that's online to respond to that question, because I don't know the answer.
Hi, Mr. Mayor. So it was my understanding that, and I could be corrected if I misheard this, but that the chair at the time or the deputy mayor had called to see if anybody else wanted to speak. And it's entirely possible that the deputy mayor didn't have the information in front of her that Councillor Principe did want to speak. That's why I jumped on to clarify. So unfortunately, it looks like that opportunity has since passed. And so the vote has already been taken, but Mr. Mayor, it is fully at your discretion if you'd like to allow the councillor now to speak, and I'll turn it back over to yourself.
So I have that discretion, okay? And because of the circumstances, and also recognizing that Councillor Principe needed to clarify her position, so I'll use my discretion to allow her to speak.
Well, thank you, Mr. Mayor. I do appreciate that. I wanted to let you know that I do definitely support the intent of your motion. I was just, it is my nature to, try to work with people and not just people, all levels of government first, instead of before making the motion. So I just feel that would be more productive and inclusive and just more agreeable to try to form that or to get that information before passing it as a motion. That's all I was, but I do agree with the intent. That's what I just wanted to relay. So thank you.
Thank you, Councillor Principe. Appreciate that. Okay, all right, now we have voted on Councillor Tank's motion. I'll go to the list if anyone else is there. And I'll look at the screen as well. So I see no one else for anything else. And then we have no bylaws with no private reports. We are adjourned. Thank you everyone for indulging on Friday afternoon.